and introduce you. Okay. Mm-mm, mm-mm, mm, mm-mm, mm, mm-mm, mm. Okay. Now we're ready. Welcome, welcome, welcome to Medical Mondays with Dr. O. What a great day. Beautiful weather in Maryland. We are loving it. So I'm Dr. Toyin Okwesami. I'm a family practitioner. I treat HIV and addictions in Maryland and host Medical Mondays with Dr. O. This month is Mental Health Month. We have enjoyed, farming. If you missed that, please go and see the 5-week series that Papa Dr. Mike Oye did on YouTube, so that you can catch up on growing your very own organic foods in your backyards or in pots, uh, big paper bags, and various ways, or in your yard. But we're switching gears because we need to pay attention to mental health since this month is devoted to it. So, Dr. Aluyah has been, a blessing to us, one of ours, our ex-president at NAPAC, Nigerian American Public Affairs Committee, who, I think is a life president. It's now BOT, the big guys. Anyways, he's going to be talking to us tonight to help us bridge that gap that needs to be bridged, especially because of the stigma attached to mental health. So, Dr. Aluyah, I know you can complete this introduction for me, but I'm yielding the floor to you. Welcome, bro.
Good. Thank you so much. Appreciate the invitation once again. It's a pleasure to be here. And as usual, thank you, Dr. Kwesami, for the incredible work that you do serving our community, um, both here and worldwide, as a matter of fact. A lot of people reach out and see you and hear all the great work that you're doing and the platform that you've created um, for issues to be addressed, and especially salient issues that often people forget and people are uncomfortable talking about. For giving voice to the voiceless and sight to those who are often not seen or hidden. So again, it's helping our community to be out there and people hear what we say and we have to do. And besides, it's giving back. And I thank you for helping to put this together. The beautiful thing is this: you have been consistent. Come rain, come shine, irrespective, you'll be consistent. So, and that's one cardinal sign of somebody who is doing great things that are made to be great as well. So thank you, thank you, thank you. So and yes, so when you ask, it's Mental Health Month, and of course we have medical issues to address. Um, and I can't say no to my sister, who has a number of times gotten my back. I was supposed to be in Maryland this past weekend for something I dragged her into. But she stood there very well on my behalf, Gidigba, like they say in Nigeria, and took the big chunk of all the oath. And I thank you for again raising Africa up. It was Africa Day, so thank you for that. So to the topic today, chronic medical diseases and mental health. Um, what is chronic medical disease, a medical problem? Often in medicine, we say things are usually chronic when it's 2 weeks and beyond. However, in the definition of chronic medical disease, it's usually CDC defines it as a disease often lasting up to a year or more that requires medical attention um, consistently and treatment that will need, medications, therapy, or one form or the other, that affects the individual's lifestyle, capacity to function, and even death as well. So that's the definition in loose form of what chronic medical disease is. Now, we all know that the United States spends about 18% of its GDP on health, and that's huge. Four times the nearest developed country in the world, and yet we still have all the big issues that we have and all the problems that we do have in America in terms of healthcare. That's again, we may dive into that, one of the reasons why and all that. But at the same time, that's about $4.6 trillion of the money that's being spent here in the United States. And like they said, four out of, no, 6 out of 10 Americans is living with one chronic medical disease or the other. And 4 out of 10 living with at least two chronic medical disease. And it's so rampant. You see, first time anybody, oh, what do you have? Hypertension. It's a chronic medical disease. And then you have diabetes. That's 4 out of 10. And on top of that, God forbid, cholesterol is now described as a disease as well. And then you have chronic kidney disease, chronic liver disease, chronic leg ulcers, and all those things that result in chronic medical issues. And as individuals, when somebody has been diagnosed with one, and God forbid the big C as well, it becomes a big burden, not just on the individual, but also on the family as well. And of course, it's a big burden on the healthcare system in itself. Because like I said, towards, I think, some percentage, 15% or so of individuals with chronic medical disease spend most of the healthcare dollars towards the end time of life. And that's what it is. So what does it mean when you have a chronic medical disease and you're living with it? But we want to discuss achieving good health when you have chronic medical disease. Now, and I'll start as a pediatrician, and I'll start from the bottom, from the basics, because nobody was born with the disease. I said very few people who were born with chronic diseases that become eventually chronic. And the social, some of you will hear what they call social determinants of health, the things that socially affect how health is determined multiple ways. However, I posted something this evening called structural determinants of health. Where structural determinants of health, going back to the basics, are some of the things that determine your access to health and welfare. Those factors, those are the social, economic, political factors that determine your access to health or health and well-being. And that will determine where you were born, the way you live your life, how you live it, and even how you die, as a matter of fact, as well. So those are structural determinants of health. We're talking about access to healthcare, level of education, employment, the building that you live in, the city you live in, the kind of water you live in, policies in that state or in that city. All of those things determine, that those are the structural factors that determine your health and welfare. Now, again, going back to the basics, that determines where a child is even born. Because if a child is born in, low socioeconomic status, one, the mother may not have access to adequate healthcare. Probably not enough or adequate as what do you call it? Obstetric care. And not just that, even the food that she eats, may affect that as well. So eventually that child is one, born, either the mother has diabetes, gestational diabetes, and the child is born because the child has now become macrosomic, big baby. So obviously that child will be born, if it's going to be given to that baby vaginally, show that dystocia or obstructed labor are some of the things that affect. And then you have a child being born with CP. So indefinitely for the rest of that child's life is going to live with CP. Now, if you have a mother who lives in, areas where they're exposed to drug use and all that, those child will be born, with exposure to drug and drug abuse. So that child is born with or withdrawal symptoms already, and all the facies of with what do you call it, chronic disease use or alcohol use, and mental retardation and all that. So you find out that that child is set up for life based on where that child was born. So taking that, and then the environment they live. If the child was born premature, hey, the child will spend years in months in the incubator because the child was born premature and too little to survive. So the child will be at 6 weeks. As a pediatrician, we used to see some of them a year, 6, 9 months. And by the time they leave, now they have chronic lung disease. I remember once as a resident, I was called to see this, as a what do you call it? MOD, medical officer on duty. I was called to see this, young guy who was in the ER, and the ER attendant called me like, Dr. Louis, I was a resident. Oh, please come check out this young man who seems to be so sick. He has COPD. But I wonder why he will have COPD at this age. And I came and I looked at him. Yes, he was about 25, but his lungs looked like he was 60. He hasn't really been smoking that much. And the first question I asked him, hey, were you born premature? He's like, oh my God, nobody ever asked me that. I said, yes, med peace is good. you know, Being a pediatrician and an adult medicine, you can think of those things. So I said, yes, your lung is like that of a 60-year-old, even if you haven't smoked, because you spent a number of months in the ICU. So those kids are born with chronic lung disease. So you can imagine already. So that's a chronic lung disease. Now we have children who have retinopathy, difficulty issues with the eye. We talked about mental, all that. So all of that put together are children who live with congenital heart disease as well because they were born and they've had to live with those surgeries. Some of you will know what TOF is, teratology of Fallot, where they have abnormal shape, and opening defective valves in the heart. We have all the other valvular heart diseases, and all the other things. So they have, because back in the day they used to die. Now they live long. So they're living longer and they have all the complications. So again, these are individuals who live their life with chronic lung disease ab initio, meaning from the beginning. Now, how does that feel? How does that work with those individuals? And I'll take it from there again. For children who are born to mothers who smoke, an environment where they smoke, again, they're exposed to smoking and all the other things. And then they have issues of asthma and all the other things. And then for those that concerns those of people of color, those of African descent, sickle cell disease. That's another one. And these are lifelong chronic medical disease that individuals will live through. So we're talking of from basic, from childhood. And there's a typical habitus. The way, if you see a sickle cell patient, you know what they look like. If you see somebody who has asthma, live long with it, you see a doctor, you know what they look like. Or any medical condition, CP, mental retardation, Down syndrome, all of those, you know what they look like. So these are individuals who eventually, thank God technology and great healthcare, they're living longer and longer again. And we see these individuals as they go on. Now, taking on, I tell people this, and I was telling a group of people where I went for what do you call it, a small conference on sickle cell, that these individuals, as they grow up, they're taken care of by pediatricians. Pediatricians are nice, soft, they give you lollipop, they do all of those things. And the care is so cool and nice. And they love the pediatrician. Everybody loves their pediatrician. But by the time you get to 15, 16, you begin to become an adult. Then issues come up. You have pressure of school, you have all of this. And God forbid, if you spend multiple time in the hospital, multiple transfusions, you're back, behind in school and all that. And then puberty hits. For men, the voice breakdown. Women, hormones kick in, and you have menstrual periods and all the other issues. And then you now have issues of of dealing with social norms and acceptance. And now people begin to look at you as an adult. You get to 16, 17, they begin to look like you need to transition. Being a teenager is one of the most difficult times of anybody's life. For those of us who cuss through, look back in your teenage life. How difficult. And some of the people you hated growing up, even when you know they love you the most, but you hated them because they were making you conform to rules and regulations that was constraining. Especially for those of us who are here, when you tell your children you cannot go out, don't go out for a sleepover. Like, mom, I can't go out for a sleepover. But James is going out for a sleepover. Like, yeah, those ones are Igbo people. We can't do that. We don't do that in our homes and all that. They don't understand that. They can't get it. And they start getting angry. So those social dynamics and relationships and all that, view relationships, the exposure outside of the typical family nucleus into the world becomes really hard. Now, on top of that, the chronic medical disease. It's really difficult. And that's where we often lose these children. That's where we often lose them. And a lot of them, unfortunately, die during those periods. And I've seen a lot of them who have lost or fell through the cracks. Lupus is one of them. I've seen child who, from that transition period, died through. I've seen somebody from sickle cell going through. I've seen somebody who has diabetes as a child, the insulin-dependent diabetes type 1, who couldn't transition properly into adulthood. Because then now your mother is no longer counting your calories. The mother is no longer counting how much food you eat and restricting that. Now you have to do all of those. You have to give yourself insulin and all that. So those are really difficult times for these individuals. And it's really, really, really bothersome. And that's where, at any point in time, for the healthcare industry, there has to be a 360 multi discipline approach to their care. Meaning you have the pediatrician who would give soft landing to that child. Meaning, hey, you know what? You're becoming an adult now. These are the things we need to do. Please, I'll introduce you to what do you call it? An internist, an adult doctor. Because a lot of times they just left like that. Boom. Go find your doctor. And that's why you find out that a lot of them have the complications that they do have. Why? Because from that age where you say, oh, I can no longer see you, a doctor will say, oh, I only see age till 19. The guy just turned 19 or the girl just turned 19, and then I can no longer see you, without making proper arrangement for transition for that individual to seeing an adult. Pediatricians and as parents, please, when you have anybody, know anybody, friends, family, child, anybody, grandchild, who has chronic medical issues that need to be transitioned, it's a sit-down process. You have to sit with a pediatrician. Who do you recommend for us to follow as a primary care physician? Who do you know who would also continue the care with specialist care, if it's diabetes, if it's chronic kidney disease, if anything else, so that transition process is really good. Because what I've seen is that a lot of the times when they're left, they have school and everything else to deal with. For a period of between 3 to 5 years, they never seen any doctor. They never seen any doctor. And if they do have contact with the healthcare, guess what? It's through the ER. And the ER don't care. They just bundle you, put a bandage. If it's dehydration, they give you. If it's a pain medicine, they give you. Sometimes they don't even give you anything. And then send you back on your way home. And then the is back again. And then it becomes a real confusing burden, even to the family, because they don't understand this. And that's why, as a parent or anybody, as an advocate, and that's what we begin to be here over these months and years that we're doing this, so that you also can be an advocate for individual people in your family, in your circles, in your church, whatever, as long as they allow you or give you, the reign, the chance to be able to be of help to them, so that you have that discussion and say, you know what, pediatrician, please, what's the process? How do we do this? How do we transition properly? And if there's none, call your insurance company and ask for a social worker. They all have social workers. They will help you transition these things, even if the pediatrician do not understand or don't get it. You understand? So that you have proper transition. Because again, like I said, mental issues and stressors for a teenager is so overwhelming often enough. If you add a chronic medical disease on top of it, it's a double whammy. It's really difficult. And that's why a lot of them fall through the, and especially God forbid if they don't have the ideal family support or structure, it's done. It's a goner, and those are people you see have been lost. And unfortunately, I don't think there's any adequate account and record of all of those things, handling those. Maybe somebody somewhere would take a look at that and publish something so that they'll draw attention to it. And one of the things that MedPeace is supposed to cover, though they don't have, a lot of them are supposed to serve as a branch, as a building, bridge from that transition of pediatrics to adult. And unfortunately, we don't have enough of them. And a lot of people in major hospitals or even towns don't even do that. And the few who have done MedPeace don't even practice both anymore anyways. Some of them do just the pediatrics, or some of them do just the adults. So that's, the issue. So the mental issues that come with it, depression, anxiety, ADHD, attention deficit, you'll be shocked. Opposition defiance, that they do have, truancy, and all of those things that come with that. Again, that teenagers go through, and some people say, oh, they're just acting as a teenager. All of those things are compounded when they have chronic medical issues. So, but then those people, those individuals of children become adults, and they have to, deal with being an adult and eventually becoming a parent and everything else. Now, coming to those adults who never had chronic medical issues, that were not born with that. Now, the lifestyle that they live, alcohol use. We've seen some people who drank too much and then affected their liver, they have chronic liver disease. Or if it's too much, it affects the brain. They have the alcohol brain fog, or what they call, what do you call it? Winnicke-Korsakoff disease, for some of you who know those. For those who have asthma, they live on or develop asthma subsequently, even as adults. We've seen that. For those who, for some reason, smoke, now they have COPD. In this country, I think, was it 16.3 million people are living with diseases that are caused by smoking alone. So that's a huge number. And then we can talk about those who develop high blood pressure, even at younger age, 30 years old, high blood pressure. Now, one of the things that some people even do forget is weight. Weight, unfortunately, has now become a disease in itself. And that's why we have all this medication treating them. As people have said, if you're obese at age 10, the chances that you'll be obese for the rest of your life is really high, over 50%. So, and that's why when, as adults, you can't spoil that child so much with love that you ruin the child's health. That's so that when they want it, no, you send them no. Even if they hate you today, they'll love you for you tomorrow. Period. It's okay to say no. And I've always said this, look, to your children, you can be friendly, but you're not their friend. You're not their friend. You're the parent. So you can be friendly with them, but you're not their friend. And when they step out of bounds, listen, you call them to order. Listen, look, don't ever say that to me. And they know Nigerian parents or African parents anyway. Don't. If they say that in those places, homes, not here. It's a different story. And then you can add one Yoruba, Igbo, or Hausa on top of it, or Tiv, or Gan, or whatever language that you speak, so that they understand, that no, in this household is not like that. If I say no, is no, because I love you and I care, and that's the reason why. Eventually, they'll thank you for that. Because again, the social stigma and the habitus of being overweight is huge. We know what that does to the mental health, right? It's so profound. So these are the issues as they go on, even to becoming an adult. So if you have obesity, which is the almost the flag bearer for a lot of things: diabetes, high blood pressure, chronic kidney disease, poor asthma, poor immune status. All of that um, would lead to outcomes in the future that would lead to chronic medical disease. Now, what is chronic disease? The severity of it. Some people have been living with it. One of the other things we even fail to address: addiction. Addiction is a big issue too. It's a chronic medical disease. Some people pick it up at young age. Even the tobacco that we talk about, the drug use, the marijuana, and all the even in some places it's legal. And I was telling some kids the other day, I said, listen, the marijuana that your parents smoked is not the same marijuana you're smoking today. You need to know that. You understand? The THC component in it back in the days was about 6. Today, it's been genetically modified. It's up to 10 milligrams per ounce of marijuana. So it's a whole lot more addictive compared to, when the baby boomers smoked it and they thought they were really cool. So it's different. So it does also affect the brain and how you respond and all the other things and the metabolic processes that you have to do and as you grow up to become an adult to adjust to the new life of being an adult. So all of that put together have their own individual classic mental issues. Now, for those who are an adult, we'll take an example for high blood pressure. All of a sudden, you find out you have high blood pressure, right? You have to take it. Just having that alone, it's a kick to your um, um, social welfare and mental status and to your confidence, because how dare I've had some people say, how dare it's impossible for me to have high blood pressure, it's impossible for me to have diabetes. Why? It never runs in my family. Why do I have it now? I reject it in Jesus' name. All of those things that people have said, you know because of that, the thought alone that you have to take medication for the rest of your life, and that's why some of them don't even take it. They're like, doc, I see some like, so you're not taking the medication? No, I didn't, because I thought I was fine. I'm like, dude. Well, if you come, you and I will sit and we'll discuss and plan how you take you off your medication. And they don't take, like, really, doc? You mean I have to take this for the rest of my life? I said, look, unfortunately, it can be so. However, with this plan, you don't have to. And we continue to monitor you. So because of that, some of them run away. They don't show up in the doctor's office for a year or two until something bad really happens, or even 5 years. And then they have a headache or something happens, they go to the ER and then I follow up with you, and then they show up, or God forbid, they already have stroke. And then it's too late. It's like losing an eye to see better. So these are some of the, just having that, what that would do to your mental state, having to take blood pressure. And not just that, the finances involved in that, because you have to buy this medicine. If you don't have insurance, it's a burden as well. Some of the money you could have sent to your little nephews back home is what you use to buy blood pressure pill. And then they talk about the side effects. For men, hey, it's affecting, the big man downstairs, and it's no longer working. And if you're not working, madam gets angry, and that alone, it's one of the biggest kick you ever have in your head. So these are some of the issues that will result in loss of confidence and integrity, and that begin to affect even the way you relate with your family members at home, anger, because some people will resort to anger. It's almost like a grief process, the stages of grief. First denial, anger, and all the other things, eventually before they accept it. A lot of people go through that just from having chronic medical diagnosis alone. On top of that, you have things like cancer. You understand? So all of these things are huge when it comes to issues that affect the individual. So taking an individual level, the anger, the despondence, the denial, the withdrawal from family and friends and all that, seeking solace somewhere else. Some of them will seek solace in God and then overtly begin to become religious. There's a difference between religion and spirituality. Sleeping in church all the time. When you're supposed to be working, you're in church. Like some of us do back home in Nigeria. But here you have work to do. So they have, but some of them still, you know, and it begins to affect the way the family dynamics is played out. They don't have the time for the children. They don't have the time for the husband. The husband don't have the time for the children. It becomes an issue, and that begins to play on the mental health of the children and even the wife or the husband as well. So these are mental, changes that affect individuals from ab initio with a diagnosis, even without complications, for individuals who have chronic medical diseases. Now, from there on, you have issues where they can't function at work, they lose, their employment. Now there's compounding financial difficulties, all of that as well. Eventually, where somebody somehow, somewhere will say, you know what, I can't take this no more. And usually, comes if it's a man, where it comes to the wife will now say, you know what, I'm seeking for a divorce because you're useless. I can't have a man who don't want to do anything, who is just totally useless at home and all that. A few of some of the women I've spoken to, I said, listen, sometimes when men have these issues, it's a mental problem. Look at them like they have a disease. And I said, if your husband has a cancer right now, would you abandon him? Like, oh no, no, I won't. Oh, I'll stand there. I like it's almost the same thing. He has a mental problem going on. This is not the time to abandon him. Was he always like this? No. Was he the guy you married? No. When he was before the diagnosis or whatever, was he a provider? Yes. Was he this? Yes. So why all of a sudden he's going through a mental issue? This is when you stick by him. And if you don't have the capacity to do that, look around for family members, gather them, rally the troops, like they say. This is when, like, you rally the troops when he has cancer or chronic kidney disease. You look for solutions. This is the time to rally the troops for him or her as well. And unfortunately, I'll say this: in most times, if it's the woman that has the problem, a lot of the time the man sticks there and suck it up because you're expected to suck it up. But if it's the man that has the problem and it can't work, it can't function, look, nobody wants to listen to that. You're a man. Go out there and fend for your family and all that. But the man does not have the capacity. And as a community, the African diaspora community, especially immigrant community, these are some of the things we need to also understand. And having that sit down talk with the children to say, you know what, dad is not feeling well. Even if he's not physically feeling well, mentally he's not feeling well. He doesn't have the capacity and all that. I mean, I was talking to a young lady the other day, and the husband, they had to divorce. She moved out of the house now with two kids. And I said, was he always like this? No, he has a mental issue. And then they're blaming the mother and all that. Like when she told me, I was like, look, your husband has a mental problem. And this mental problem is things that you need to sit and rally the troops around him to give him support so that he can come out of it like and at least be able to manage it like some people talk about people living in addiction, able to live adequately and well with their disease. You know, some people say functional addicts. Yes, you have people who are functional individuals with chronic medical issues. So these are the things that begin to really become obvious and emanates in the community when individuals live with mental problems. Now, as the disease progresses out of lack of access, out of non-compliance, out of ignorance, or out of financial difficulties and not handling the problem, or just out of the progression of the disease itself. Now, it goes from stage 1 to stage 2 to stage 3 to stage 4. If it's chronic kidney disease, when the individual end up in dialysis, or lung disease, when they now talk about, hey, you need oxygen to carry oxygen around. That is even worse at that point in time. So it affects the mental state of the individual. You begin to see them not just mentally changing, but physically changing as well. Some people gain so much weight. And the hot hunky husband who you saw, who was good looking and you had the eye for, now looks so obese and, disfigured and all that, and is now so grumpy as well that you begin to hate the person that you married. And these things really do happen. So we must begin to pay attention to that. And as individuals, our role is to identify those things. And look, why are we in mosque? Why are we in churches? Why are we in Bible meetings or in places like Nepal? So that you have resources that will help you address issues when you don't know how to do them. So if there's something going on, I mean, we're talking here right now. You can call Dr. O, and Dr. O will call me, or call Dr. Zugu, or anybody and say, listen, this is what's happening. How do we address this? Do you have people with the capacity to addressing these issues like this? What are the things that we need to do to give them the opportunity to be able to take care of themselves? What are the medications that they need to take without the adverse reactions, adverse side effects, and all of those? You look, like I said, a problem, what do you call it? Talked about is a problem half solved. So if you stay silent with your problem, then it becomes a problem that is multiplied or multiple for focal. And that's why it's important that we begin to address these issues as well. And I'll round up by saying this on cancer, because that's one of the big questions that we don't want to hear. The big C diagnosis. I've had to tell a lot of people recently that. Again, what does that mean? I'll begin from where I will always start. If there's one thing you're going to take out of here today, please, everyone should have a primary care doctor, period. Have a primary care doctor. We talked about this one before. Have a primary care doctor where you at least for once a year, and it's legal. It's authorized and legal. You spend 30 minutes with your doctor, sit with your doctor, and decide what your healthcare plan is looking like. Do you have chronic kidney disease? Do you have diabetes? Are you at risk for diabetes? Are you because nobody wakes up all of a sudden become diabetic. Now technology can let us know that you are no diabetic, pre-diabetic, and eventually become diabetic. Is your kidney spilling protein or albumin? We have medications to help protect that. Are you in the beginning stages of a liver disease or pancreatic disease or any of those things? These are the things that your primary care doctor will sit with you at that point in time and have a practice discussion. And you have 30 minutes, 30 whole minutes. If you want to get like, no, doc, sit down. I have 30 minutes with you today. It's my turn. No, you have the right to say that. You understand? And look, I've always said it, come prepared. For your once a year meeting, come prepared. Dress nice, put on your nice clothes like you're going to church. Write down the things that you want. Write them down, your questions. All of this, write them, all of them down and say, hey, doc, these are my concerns. These are my issues. Discuss any issues. If your cousin was diagnosed with cancer 2 months ago or last year, and this year you're meeting your doctor, discuss that cancer with them. Because guess what? Some of these cancers run in families. They really do. You understand? We heard recently, our former president was diagnosed with cancer, prostate cancer. Is it related to the cancer his son had? No association. But guess what? These are frank discussions that needs to be had when you have a 30 minutes, meeting with your doctor, period. And at those times, your doctor would sit and pay attention to you and listen to you and come with a plan so that plan will be a plan for next year. And that plan is something you work on. And if you can't work on it or you're ashamed to go back, ask Dr. Gunko, ask Dr. Okoyemi, ask Dr. Aluyah, or anybody else. Call them up and say, hey, doc, I'm afraid, or what the doctor says, I can't handle it, it's difficult. Then you have those discussions with them. And then before you go back, you can always call another question, another meeting with your doctor. But at that point in time, he only has 15 minutes with you. Now, one of the things I'll tell you again, outside of having your primary doctor, whenever you do a test, please set, before you leave the doctor's office, 2 weeks after your test, the doctor is giving you paper to do tests, go do blood work, go do CT scan, go do MRI, go any test you do. 2 weeks after, you have an appointment to go sit with your doctor, period. 2 weeks after, have an appointment, sit with your doctor, so your doctor will sit with you 15 minutes. And that is the result that you have to discuss with. period. If it's something that has to do with issues, then they'll address it. Because guess what? A lot of the results come to doctors. You don't want to be the one who falls through the crack. You really don't. Because the results come to the doctor, you don't know what state of mind the doctor is when he's looking at your results. To the point where your kidney function is deteriorated. Maybe at that point in time, they call and, doc, somebody's in the hospital, they're having, you pick up the phone, and then this address, by the time it comes back to your results, you skip that section. It's done. You will not even know it, and you will miss it. And that's you falling through the crack. So if you have an appointment with him, sitting with your doctor, he's going to open it. And you can see it. For me, I call them, come sit next to me. They sit next to me. We'll be going through one by one so that you know this is your kidney, this is your liver, this is your what. And then you, because I'm empowering you as well, because it's your health. You only see me, the maximum you have 30 minutes with me. You are living with yourself 247. So who knows yourself better than you? It's you. So as you have those meetings and those appointments, then you can schedule any other appointment with your doctor as you see well. So those are the issues. Now, if you have chronic medical disease, in all sincerity, follow up with your doctor at least every 3 months, unless your doctor has told you to 4 months. I have people I see 2 weeks, a month after, but on the average, especially until your disease becomes stable, if it's kidney, if it's liver, it's whatever, that the disease is stable or controlled, every 3 months, unless otherwise specified. So your doctor can say, you know what, I see you 2 times every 3 months or 4 times every 3 months, you're doing well, come back 4 months or come back 6 months. And then you can go back and know that you're doing well. But don't go back and forget and go back to either the drinking or whatever you're doing. So these are steps in order to handle. Because at that point in time also, you can sit with the doctor and discuss your mental health issues. And some of the things that are really disturbing you. Sometimes it may be financial. You'll be shocked. The doctor may know somebody who can give you, directions and help on financial issues or how to get help. For instance, now you just came out from rehab because you fell and you have hip problem from osteoporosis and you're home. All your kids are all going to work and nobody's home. Madam has to go to work. They can give you FMLA. Some of you know what FMLA is, family leave, whatever. Your doctor can fill it for you so that your wife can stay with you for a short while, or God forbid, you can be at home without necessarily losing your job because of health issues. Because if you lose your job because of health issues, then that compounds financial and then compounds medical issues. So the FMLA will help you or even help your wife to stay with you for a short while. Now, after that, you can also get a home health aide that can come to your house and help you clean, help you shop, help you do a few things for those who don't have families here. So these are some of the things that we can do to live healthy as we live with our diseases. So, but again, above all, take your medicine, take your medicine, take your medicine, adhere to the plans and advice of your doctor, and set up follow-up appointments at least 3 times every time you see the doctor. Leave the office with an appointment 3 times or every 3 months, unless otherwise specified. Thank you, and God bless you all.
Wow. Thank you so much. So true. On point. Chronic illnesses lead to mental illness. It's a known fact. I wanted to mention heart attack also. We've seen in medicine that people who have had heart attack or even stroke then develop depression because their heart is not the same again. They didn't take their blood pressure medications. That's the beginning of it. Like, just a typical example of what you just said. They have high blood pressure, didn't treat it, get heart attack or stroke, and then develop depression. Because if it's a heart attack, exercise endurance go down, they walk a little bit, the heart is not taking it anymore, or what have you. And a stroke, they may not recover completely or not recover at all. And then they're depressed. So treating chronic illnesses, thank you so much for tying it together beautifully the way you did. That these things we've been talking about, and we've talked about a lot of this on Medical Mondays, diabetes, obesity are important to treat so that they don't then lead to mental illness. At least that's the message I got. Am I right? Are you muted?
Somebody has questions? It's okay.
Okay. So I said, am I right?
Oh, yes, you
You
are.
linked,
Definitely.
chronic illness to depression. So
Right.
yeah, if anyone has a question, you can raise your hand or put it in the chat box. I wanted to ask you though, before I call on Dr. Izugu, postpartum depression also. You want to say something quickly about that? Because our people I've seen a lot of people, families torn apart who don't understand that concept. They don't know that after childbirth, these things can happen, and it tears everyone apart. Can you comment on that real quick?
Yes. So we as a people originally are a very communal people. And that's why certain diseases, especially mental health diseases, um, we're not privy to them. We're not exposed to them. You know why? Because you have a lot of help back home. I mean, you can imagine somebody give birth back home. Before you even give birth, the amount of help you have is so much. And once the baby comes, grandma is here, grand auntie is here, everybody's there. They help watch the baby, they clean the baby and all that. So you just sit, you can't cook, you can't, all of those things are the things that help you to adjust and accept. And then well, guess what? They talk to you as well. They give you advice. Even when you're feeling a little depressed, they'll take you. They can go wash you up and all that. So you find out that in our culture, we never saw those things. You understand? And that's why here now, all of a sudden, you find out that hey, by time the woman is pregnant, they're calculating how to bring grandma from Nigeria to the US, right? Either grandma or either side, you know. So you begin to calculate that. But here, I have seen a young Ghanaian woman. That child is like what now? Almost 16. When she first had the child, that woman went into depression. She really did. And a lot of time I had to bring her in multiple times. She's Ghanaian. She had moved into this country not too long. She gave birth to a baby, her first child, and she will come to the office and cry and cry and cry. I used to leave her so that she'll be my last patient, and we just spend time. We just talk till today. She's still my patient, you know. And we just talk and advise her. Where's the husband? The husband is out there working, work for a pharmaceutical company, and the work demand was so much. She's like, "Oh, Dr. Aluyah, I don't notice how America is. Oh my God, I shouldn't have even come here. I wish I was home and all that, you know." So she went through that and eventually had another child. And of course, we build confidence and strength and everything over months and build that. So in our community here in the United States, where you don't have help, these are some of the things that happen. Postpartum blues. Blues come from the process of pregnancy. God did it 9 whole months. But before that, started getting you ready. Oh, and I always tell women, those periods that you get every month, that cause a lot of pain. There's a reason for it. God is not silly. What he does to the pain areas is begins to expand it slowly, slowly every month so that you begin to build tolerance towards eventually when you get pregnant. And then you see the hormones come up. Those relaxings that begins to relax the joints, the whole joints of the body. Can you imagine the pelvis expanding and then giving birth to a live human being with big head? you know, that that cannot happen in 2 months, 3 months. You understand? So it's a whole process of going through that. So all that process, gaining weight and the hormonal changes that take place, once the baby is out, because that's a foreign body inside of you anyways, but once the baby is out, that producing hormones and all that is out, everything shuts down so quickly, so abruptly as well, as compared to how the baby took months to get there. And then all of a sudden the baby's out, boom, you're left by yourself. Nature just left you. You understand? So now you have to contend with that. So you can imagine how that feels. So your whole body is going through a process, including the brain. Because as your body grows big, guess what? The brain cells get the matters as well. So as the brain cells and all the water in the brain cells begin to shrink, all the areas of the brain that's used to that volume begins to shrink as well. So obvious, the mental changes begin to do things, and that's what the blues that take place. And that's when, because if you have a great structure and support, it's important that you get the help that you do. And thank God now they used to give family leave for women. Now they've decided that, hey, you know what, men need that too because they go through blues. They're thinking about the amount of diaper they have to buy and all the financial burden and all the hassles they have to go through, you know. So all of that as well. And sometimes even the few months or 6 weeks they have to go without. You understand? So people don't think about that as well. So those are issues that affect the man and his mental state. So these things happen, yes, but it depends on how what kind of help and support that you do get. We had an event yesterday, this Saturday, with the mayor of Newark, who's running for governor, and one of um my sweetest darling sister, I'll call her name Pat Ogre Okufu. Uh, God bless her. My daughter was born via C-section, and she was quite a big lady, the big baby. Mother didn't have diabetes, but she was just big, so they had to put her in a NICU for a short while. And I used to go as a young man. They look at you like, "Is this your baby?" And I said, "Yes." And like, "Oh my God, really? Jeez!" And then compared to all the babies in the NICU, she looked like a giant. So, and she was 6 sessions, but by the time she was ready, to kept her for 2 days. So after that, she was discharged. I had to take her home. But the mother wasn't ready to come home. So Pat was there and helped take Stephanie home. And I remember she was reminding Stephanie on Saturday, like, Stephanie, when we took you home, we put you on the dining table. And Stephanie is so much bigger than she is right now. And she was shy. Again, that's the kind of support. We were young, we were, just starting the family and all that before others came around. But she's a friend who was there with us from the beginning, and when all that period I had to write my exams, wife had to work, so she would cry. I remember putting her on my back to study, and then in between, when the short time that mom has to go to work and I come back, she'll be with the neighbor or Pat will come, and Pat used to sing out this song that she sings to her. You understand? And when she sings this song, the child will keep quiet. You know. So again, these are the things that help, giving support for a mother who had just given birth. And then, of course, the members of the church came around. It was really helpful. Some came to give back to the baby. Um, the community, the adult community, and all that, the uncles and aunties, they came. So if my wife went through blues, I'm sure she did. Maybe I didn't notice it that much, So that's what support, for do for us, and that's why as a community, it's important to be involved with the church, involved with community activities, so that you get the kind of help that you do, especially in a country like this. We can't live as an island. Some people run away. Oh, I don't want to do with Nigerians. Who you want to deal with? Jamaicans or Russians? Or Jews, you think they give a damn about you? Nobody will give a damn about you more than your own kind of people. Oh, look, even the Jews have their problems. The Indians have their problems. They fight. You understand? And I've heard when other people talk about Nigerians, oh my God, you Nigerians are so tight. You're so close. You're so. I just laugh. I say, yes, we are. We love one another, even if we fight inside the house.
Yeah. Thank you so much. Thank you. Dr. Izugo, kindly unmute. Thank you.
Sure, sure. Aluyah, thanks again for your presentation. That was really good. I just went to underscore a couple of things that you mentioned, and that is really the importance of having a primary care doctor. Even if you're a doctor, you need your own primary care doctor. And when you go to see your primary care doctor, don't tell the doctor let them treat you like every patient else, okay? Because you are now a patient to that doctor.
Right.
I have my own primary care doctor. Now, when it comes to chronic condition, the most important thing is to pick it up early. So don't get frustrated. When you pick it up early, it's actually a beautiful thing, because every chronic condition is progressive. It's like a child, they grow. Ignoring it can be very, very bad. But when you learn about it and manage it with an expert, you can actually have total control of that chronic condition. When you start managing it, take for instance hypertension or even heart failure, and then all of a sudden you're now in a cruise control, your numbers are good. That's not the time to stop your medicine. If your house is leaking and you put a patch on the roof, and the leak stop, you don't go take the patch off. Because if you do, everything will crumble. And Aluyah, if you can comment for us, please. That big belly, yeah, is a chronic medical condition. Please.
Yes, and that's why we talked about.
So it's not rich money. It's not money wealthy. It's not evidence of good living.
No.
So, and that's why I talked about obesity and bringing it up from childhood, because obesity has now also become a chronic medical disease. You understand? And that's why we have all these medications and all these interventions that they have to handle. Because again, like I said, it's the harbinger of the conveyor of almost 90% of chronic medical disease, including cancer. Obesity has been associated with cancer as well, heart disease, diabetes, chronic kidney disease, you just name it, all of them. So it's important to stay fit, first and foremost. I always tell people to look, just find a routine every day that will help your heart race. Let your heart race once every day. Once. At least if you can do it in the morning, better. I do mine in the morning every day before I take a shower. You understand? And I don't have the time to go to the gym. I really don't. Even if I pay, I don't go. I've been looking for gym partner for the last 2 years. So, well, I just exercise at home every day, because unfortunately the lifestyle we live is not ideal, but you know yourself more than anybody else, and you'll be able to handle those things. So staying fit is the most important thing. Like I said, a rolling stone gathers no moss. If you have an exercise that you do every day, that your heart pumps and pumps the fluid through the pipe, because all those veins are pipes, right? If the blood flow is flowing the pipes every day, flow free, where would the blockage come from? It's impossible. It's not going to block. You understand? And your body would eat up the sugar. And I've said this before, and I say it every time. Look, for those of us who are black, we're different. Let's call it spade a spade. We're really different. And I'll tell you what. The fastest people on earth, male or female, are what? They're black. The fastest people on earth, male or female, are black. Why? Why do you think they're black? You think because they have more money to train, or because they exercise more? No, it is first and foremost genetics, period. Because they say we have what they call the short fiber or short twitch muscles, or the brown muscles. Others have the long fiber or longer, twitch muscles, and that's what we have. Now, the beautiful thing is this: for us, and we're learning a whole lot of things, and that is in nitric oxide. Nitric oxide is fundamental. For some of you, I'm not sure if you guys saw the quote that I wrote one time. I still write some of these quotes. I said nitric oxide is the breath of God on our DNA. Nitric oxide is the breath of God in our DNA. What's nitric oxide? It's NO. It's a small gaseous, I'll use that element that our body can produce, and usually produces it on our the surface of our blood vessels. Now, we as a people have a lot of nitric oxide in our muscles. We really do. We're learning all of these things, and nitric oxide is huge in allowing sugar to get into our muscles, our tissue. Huge in that. Now, the unfortunate thing is nitric oxide will only last a few seconds. You produce it, boom, it's gone. Because what it does is open up the channels for a lot of things to come up. But it's also a channel mediator through cyclic AMP. That's not going too technical, to allow insulin to move the sugar into our muscles. So why is it that we're so good at running and moving so fast? because we have a lot of nitric oxide muscles in our muscles. So what happens? Boom, it opens up, we speed up, right? And guess what? Once it opens up and speed up, sugar flowing, boom, 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 and we take off better than anybody else, right? Now, for us, because we lived in Africa, we lived in temperate regions and all that, we're able to produce a lot of those nitric oxide over there, right? And help with the food that we eat and everything else. And we're constantly moving, farm, whatever, this. You know, back in the day, you have to go see grandma, you move to 2, 3 villages to go see grandma, or you come back, or all of those things kept us healthy and well. And our nitric muscles were absorbing the sugar. It therefore means for us to move, for us to eat up the sugar, we need to move. Now, if you bring that same individual who's constantly moving, creating nitric oxide, you bring them here to America, where they have a sedentary lifestyle, what happens? They no longer produce nitric oxide in the muscles. They have become very sedentary. Because the nitric oxide is not that much, not permeating, guess what? The sugar is not going through the muscles. So all the sugar you eat, what do you think it's going to do? Keep circulating in the system. It circulates for 1 month, 2 months, 6 months, you have pre-diabetes. 1 year, pre-diabetes. 5 years, you're becoming diabetic. Period. And that's exactly how the pathophysiology of what Black men, as we see here, having more of those things. It's also important in the manner in which we have coronary artery disease as well. Some people talked about the good cholesterol and all the things that we have. Nitric oxide has a huge role to play in it. Now, the unfortunate thing is this: for us as Black people, we don't have enough nitric oxide in our lungs. So because we don't, and that's why in combination with our heart, it becomes a whole lot of a problem. But once you move, it does better. So please, you have to move. For a Black person, you have to move because that's when your sugar eat, when your muscles eat. I mean, look at all of you. You have muscles all over, right? So when you move those muscles, they're all eating up. So, and that's why we talk about exercise. So we say those exercise. We never knew how well those exercises is good for us. Now we begin to know not just the top, but down to the nitty-gritty of things. I'll give you an example. So for some reason, I kind of stumbled or figured out that when my patients come in and their pressure, forget the white coat, some of them come with high blood pressure. And then when they come in, they take a deep, I tell them, do this exercise. Take a deep breath. When you're tense and your pressure is off, take a deep breath, take a deep breath. Let's all do that exercise. Everybody take a deep breath. Take a deep breath. Hold it. 1, 2, 3, 4, 5. Release it slowly. Take a deep breath one more time. Hold it. 1, 2, 3, 4, 5. Slowly release it. And one more time. 1, 2, 3, 4, 5. Take it. 1, 2, 3, 4. Release it slowly. I have found out that doing that alone drops your blood pressure, the top one, by almost 20 points, and the bottom one by 10 points. Every time, it never fails, consistently. Now, I've done that, and I've tell my patients, and I tell them what to do. But one of the things I figured out was this. My God, sometimes when I do it, I feel a little dizzy. I'm like, why am I feeling dizzy? But like, if I have a question and I don't know the answer, I'll wait until I find out. I found out more recently that in our upper airways, you see, the way God did it, He built our nose and put in empty spaces, and all which are the sinuses. All those empty spaces have received a lot of blood vessels. And like I said, the nitric oxide is produced with those blood vessels around the airways. So when you take a deep breath, air flowing through along the walls of those vessels releases nitric oxide. It does. And releases so shortly and so quickly. And that's why your blood pressure drops. So if your blood pressure is low, that's why I was feeling dizzy. I'm like, oh, now I know why. You understand? So nitric oxide is huge when it comes to all of these things. And that's why for those who also exercise and run, you see them breathing all the time. Their pressures are usually low because they're constantly producing that amount of nitric oxide in the muscles, in the blood pressures are constantly low. The heart rate are also equally low. So for Blacks, I can't really overemphasize it. Move, move, move. That's the best way to stay healthy.
Amen to that. Burn the belly fat.
Yes.
It's so bad that in medicine it has its own name, truncal obesity. So bad.
As a matter of fact, they said the bad fat stays there. They really do.
Uh-huh.
They relocate to those areas. And because they relocate to this area, one of the things you hear people say is what? Fatty liver disease,
Yeah.
right? Fatty liver disease.
Which is
And it is
now
said that over 70 to 75% of people with fatty liver disease have NASH, which is the non-alcoholic fatty steatosis that people have. That can result in chronic liver
cancer
disease and liver
eventually.
failure. You understand? So when you move, it burns down that fat.
And the breathing exercise you just showed us, that you just taught us, there's a device called Respirate. Google it, you can get it. It helps you to do those breathing exercise. When you breathe out, you blow it out. And that may be helpful for those who have high blood pressure and who wants to control it. Thank you so much, Dr. Aluyah. Dr. Ajagbe, kindly unmute.
Good evening, everyone. Thank you, Dr. Aluyah, for the elaborate, discussion on chronic diseases as it affects mental health. I'm not sure I heard you, but maybe you did. Talking about sleep, how it affects everything that you discussed. Did you do that? If you do, pardon me for missing it, but if you haven't, can you elaborate on that?
Yes, okay. Oh, of course, sleep is a big, big factor for any human being. God designed it in such a way for us to recuperate, readjust, and rejuvenate. So once you lack sleep, it's a big problem. It affects your mental health as well, big time. It affects everything. And one of the things it actually does, it puts you on override. It's like you when you drive your car and you put it on what do you call it, drive, and then you put it on.
Cruise control.
No, 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 not cruise control. There's the other one that puts it on overdrive, like a two, for those who have the 1, 2, not on drive, where you hear the car just burning like that. So it puts it on overdrive. So you're burning the whole body. What it does to the human being, it puts your body in chronic inflammatory state. You're in if you take your sometimes if you take your blood pressure, your pressure will be up. If you take your temperature, your body will feel hot. If you haven't slept for a while, you notice. And then your body will feel hot. You'll feel anxious and anxiety and all that. Your head will feel heavy, and all that's put together. So that's what sleep alone without medical issue can cause. Now, what happens is when you have chronic medical
You
condition,
mean lack of sleep?
yeah, lack of sleep. If you don't sleep, yeah, lack of sleep. So, and that's why for when they want to use that to punish people, they do sleep deprivation, like in jails and all. When they do what do you call it, interrogations and all that. When you deprive people of sleep, they begin to hallucinate in extreme conditions. They hallucinate. They go through. Yes. Oh, it's really bad. So, um, and too much of it is even bad in itself. That's another one. If you put someone in a dark room with no contact with anybody, they begin to hear and see things that are not there. They really, in fact, there's a whole lot of article written on that where people go mental just because they were in a room. That's why human contact is so important. Some people begin to see cockroaches on the ground, begin to speak to cockroaches and all that. Some of them are there, not. Now, coming to chronic medical condition. I'll give you a typical example. People with chronic liver disease, right? Now, the melatonin that we talk about, that you often give melatonin, correct? Some of you see, and they give it for sleep. Now, as we age, right, everything drops, including the pituitary. It produced for the pituitary, right? So the pituitary is not getting enough blood just with aging alone. Aging can be a chronic medical disease condition. It's not a disease, but it's chronic medical condition. So the pituitary, as it ages, reduces blood supply to the pituitary. So the amount of production of melatonin in the prostate is decreased. Now, the melatonin in the prostate goes to the liver and is broken down into the active state where it becomes useful for you for sleep, right? So if you have chronic liver disease, that process is broken. It can no longer work. So you find out that that normal sleep pattern that the individual have is changed just with that alone. Now, with chronic medical conditions as well, the same thing happens to the brain. It's not producing as much as melatonin, and the metabolism and breakdown of other products, even if it's kidney disease. Guess what? Now you now have a lot of uremia circulating in your body, chronic inflammatory state, where your whole body is put on fire. It's like, when you have the gas, you and I sitting down here now. Well, if you're relaxing and watching TV and really nice, your gas level is like 1 or 0. Now, if you are sick or tense or whatever, it's like turning the gas to a 2 or 3 or 4 or 5, depending on the amount of stress that you're going through. So your body is constantly inflamed. So if you do those inflammatory markers, you see that it's really high. You understand? Or even if it's an infections like TB or HIV and all that, put you on a chronic inflammatory state. So guess what? The blood vessels that supply every part of your body begin to get narrow and thickened. So also the blood vessels to the brain get narrowed and thickened as well. So obviously once to the pituitary is also narrowed and thickened. So all the bad products that are supposed to be released to help you, they're not being released. Now, if your body cannot get rid of materials, byproducts like the kidney, guess what? They begin to suppress even the bone marrow, suppress every tissue from functioning properly well. So that's what chronic medical disease can do to you in terms of sleep as well. So it affects your sleep, it changes the sleep pattern, it disrupts the natural sequence or progress of sleep, and by multiple ways. It's not just one. Sometimes even the medications that you take, you understand? I think, like somebody said, let food be your medicine and not medicine your food. And somebody said, I can't remember the quote. I posted it recently that, for those who take medicines to cure an illness, they have to also live long enough to cure the medicine, the effect of the medicine with another medicine. So sometimes it does happen because some of these medicines that you take also can affect your normal sleep pattern and the way your brain functions as well.
Thank you. Thank you so much. Zubair,
Well, I still
all
have
the way from
something.
Nigeria. Sorry?
I still
Yeah,
have something to.
Oh, sorry.
yeah.
Pardon
I'm
me.
back.
Give me a minute.
Oh,
Mr.
Mr.
Dagwe,
Zubair
should you
from
go
Nigeria.
quickly? It's in Nigeria.
Oh yeah, well, I see his comments.
Yeah.
Zubair, I mean.
Yeah.
Anyway, the other thing I wanted to
Yes, yes.
mention,
So,
just
questions? So good day. Yes. So good day, Dr. National Aluyah, and thank you so much for this deeply insightful discussion. I also want to sincerely thank our host, Dr. O, for putting this together. I'm joining in live from Nigeria, and every thought, despite midnight here, I stay awake just to listen. And honestly, it has been completely worth it. So, my question is, how can young people, especially students like me, an early career professional who face constant pressure, manage stress in a way that help prevent chronic diseases and protect their mental health over time? So, that is my question.
Right.
I thank you very much for having me here today.
Thank
Good.
you so
Thank
much.
you.
Thank you.
Thank you. So again, the beauty of being young is you have everything intact as long as you don't destroy it with other chemicals like smoking, alcohol, and all that, which some young people indulge in. However, one of the best medicine for mental health, especially for young and for anybody, is to surround yourself with a network of support. Surround yourself with a network of support. And that's why you find that young people are constantly going out there. You can't tie them at home. They're constantly seeking those validation and security and whatever. You can't, it's not their fault. You understand? They're wired like that. Because the neurons, as they begin to wire and grow, it's a networking, new flashes that are formed. So they need to, get it out of themselves. And the only way to do that is to form networks, right? And that networks help them in coping. And that's why, unfortunately, they will tell their friends some of the things they won't even tell you as a mom or dad. Because again, the people who they meet function at that frequency with them. You are on another frequency. And that's why, like, wow, you don't understand, or pa, you don't understand. So that network is so good for them. And that's why during COVID, they said, listen, don't take away your children's access to the cell phone or whatever, because it affects their mental, and that's the only way they can network with their friends. Now, the networking is good, but always surround yourself with pleasurable people. Pleasurable. People who are equally happy. You understand? If you're with sad people, you'll be you'll be sad as well. Surround yourself with pleasurable people, people who will give you stimulation, who trigger you to happiness, or who would, whose thoughts and process towards you really does help and elevate you as well. Because if you're with the other person who gives you stress, and that's why at that point in time, having a girlfriend or a boyfriend who give you stress is detrimental to you. And that's why, unfortunately, those who turn out really bad are those who are in a relationship that are locked in. Meaning, hey, you're my girlfriend now. Don't talk to nobody else. No, no. I'm you, I'm your God. Don't talk to anybody. How do you think that girl will look like in the future? Depressed, despondent, and all that. And some men do that. And don't talk to any girl, no boy, nobody, and don't even talk to your family members. And it begins to create discord where mom call you now, you can't pick up, dad calls you, you can't pick up. You understand? And the same thing with men too. They have a girlfriend, and the girlfriend like, no, I don't want you talking to nobody. I don't sit by me all the time and checking your phones, making sure you're not talking to anybody else. All of those. These are the mental trauma that your generation felt are feeling that we never had to feel. We never went through that. You understand? Because we never did all of that. So that's that. Two, learn to create an exercise regimen for yourself. And that's why if you look around, it's genetically wired. Young people are into sports. Old folks don't do sports. You understand? Young folks, because it's the genetic rewiring, even in their head. And that's why they get involved in sports. They exercise. And some of them, if they take risk. They take risk. Bungee jumping, all those things that we're afraid to do now because we want to break our muscles or break our bones. So surround yourself with people like that who inspire, who trigger you. And then guess what? When bad things come and things are hard, seek somebody who you can talk to. Seek a mentor, a primary mentor. I always use the word seek a primary mentor. It's like a primary doctor. And then seek specialist mentors. So because a mentor, a grand mentor would decide I always use this word in our community. And I gave a speech one time as well. We as a people don't have a mentorship culture. I'm sorry to say that. I'm going to say that. We as a people don't have a mentorship culture. We really did, but it was a communal mentorship structure that was broken down. Why was that communal mentorship culture? Where you go through stages of what? Initiation. When you initiate to become an adult. In our place, they call it Igbama, where you become a man. You understand? It's a process. Your group of, I think usually between an average age difference of 5 years, you're in a group. And all that group pass through processes, initiation and all that, becoming a man and all that. And then you graduate to become a man in the society. That structure was broken when the Western world came. It was. So because of that, they never had the kind of mentorship structure that they have, that we have now. So what we have, unfortunately, in place of that is a guardianship culture. And I'll tell you what the difference between guardian and a mentor. A guardian will take you, give you all you need to succeed, push you in the right direction, do all this, all that, guide you, make sure you're doing it. But guess what? They're doing it for their own purpose and satisfaction as well. You will grow, but you will never grow beyond them. You will never grow beyond their guidance because they always look at you. Look at all those people back in the days. That's what they did. I'm sorry to mention names. All those old politicians and all that, and they still do that till today. You understand? And that's why when you find out that the person who you guide or you use a guidership growing bigger than you see fight. They start fighting. Even at governorship level, they begin to fight. You understand? But a mentor will do you all of those plus, right? And create the platform for you to excel and exceed him or her with the expectation that I'm doing this, you become bigger and better than I am. And that's why Socrates, look at Socrates, the relationship with Socrates, what's these other people's name? All their group, they were mentors. Aristotle, Socrates, their relationship, one mentored the other, and onto all of the Hippocrates, all those people. You understand? Because they know that these individuals will become bigger and better than them. That's how it is in their culture. We must begin to learn to do that. So if you have a mentor who will mentor you properly, that mentor will also give you exposure to other mentees or mentors. Meaning the mentor don't know everything. The mentor will give you, hey, you know what? Financial advice, meet this person. You go meet this person for financial advice. Career advice, go meet this person. If I'm a doctor, I don't know nothing about engineering, but if I'm your mentor, I would point you in the direction where an engineer would mentor you. You understand? When it comes to life choices and religious things, there are people like, hey, I'll call this person, I'm going to send this person. That's what a great mentor will do for you as well. So having one, it's imperative. Now, when bad things eventually happen, for instance, the loss of a mother or father and all that, one of the ways, or what they call it, the principles of longevity is that you just don't count the fact that that individual died. You count and give thanks for the fact that you're able to spend time with that individual, the amount of time. Because guess what? That guy would, if you were married, that guy would have died on the day of wedding or before the wedding, right? We've had that. You plan wedding, boom, the man died, right? Or died on the day of wedding, or 2 months later, or a year later. But you got 30 years with him. You understand? So these are the things you look and value rather than the fact that the person died and left you. You understand? Or if it's a mom or dad, find out. Listen, I had my mom is 90 years old. Oh, she just died. Okay, it hurts because I'm going to miss her. But guess what? I've had her for 60 years of my life. And that's the joy and beauty. Because guess what? Your mom would have died giving birth to you, right? Or even died before giving birth to you. So these are some of the things that we must look and see that to help us cope as a young person as we move on in life.
Thank you so much. Wow. Huge caveats. Thank you. Dr. Ajagbe. Dr. Ajagbe, are you there? I know you said
Yep.
another
I'm,
question.
Who
Yeah.
is that girl? Who's that girl?
Which
I'm
one?
loving that hairdo. That girl that's speaking.
I was looking for the girl.
Ah, that girl.
I thought I
You,
sidetracked the girl for Dr. Ajagbe.
no, you look good, babe.
Thank you, ma'am.
yeah,
Dr.
I
Ajagbe.
wanted to add a little bit of things to the issue of nitric oxide. Um, for us to truly survive, we need that nitric oxide to actually prepare the air that goes into our lungs. The primary goal of nitric oxide is to open up the blood vessels, to make the blood vessels supple, and be able to expand when the blood is flowing through and can expand and contract and so on. The sinuses are primary for the air that we breathe. Whether we are asleep or awake, the air that we breathe through our nostrils are prepared. One, by filtration. Two, by moisturization, that is humidity. Three, by the addition of nitric oxide from the sinuses. The sinuses produce copious amount of nitric oxide to prepare the air for us to be able to inhale and be able to have the gaseous exchange, which is a very important part of life. That is one part of nitric oxide I wanted to add. The second part I want to add to it is our mouth. The good bacteria in our mouth is the most important factor in the aspect of nitric oxide metabolism. So the nitric oxide is produced from the bacteria in our mouth. The good bacteria, I'm not talking about the bad bacteria. The good bacteria in our mouth are the ones that actually break down the nitrates in every protein that we eat. They break down the nitrate into nitrite and then finally into nitric oxide. So the reason I'm raising this up is this. People who have chronic diseases, who also have dry mouth, who also have bad breath, will eventually go towards using mouthwashes. And the mouthwashes have been found to not to be a what do you call equal opportunity destroyer. They destroy both the good and the bad bacteria in the mouth. And when the good bacteria in the mouth are destroyed with the with the bad bacteria, then the blood pressure goes up. So it doesn't matter what medication the patient is on. Since the nitric oxide production that is coming from the nitrates that we ingest as part of our food is broken down because the bacteria are no longer, efficient or are no longer available to work to do the conversion of nitrates through nitrite to nitric oxide, then the blood pressure goes up. So that's something new that's been in literature recently that I think I've shared on this platform before. So I wanted to just add that to it that uh, chronic diseases is not only just for the systemic issues, only organs, but it affects and it comes, from every other part of the body, oral cavity, sinuses, and stuff like that. So thank you for letting me share that.
Thank you. Thank you so much. Dr. Aluyah, any comments before I go to the chat box?
No, good.
Fantastic. So, someone asked, when an individual has liposuction done, can they see their primary care doctor or do they only have to see the doctor that performed the surgery?
Yes, before you even have your liposuction, you must see your primary care. Must
For
see your
clearance.
before you get your liposuction. Because for you to start having liposuction, maybe you obese or you have other issues, and you want to make sure you don't have any chronic medical problem. For instance, things that put you at risk for blood clots. You understand? Because when you do that, your risk for blood clots is really high. You don't want to have high blood pressure when you go through that process of liposuctioning. Because guess what? Your pressure will go up and boom. Some people have died when they do that, right? We've had Kanye West's mother, former president of Nigeria's wife.
Stella Obasanjo.
Yes, Martin Luther King's wife and all that. So all of those things, you have to see your primary care doctor to make sure you're in good health, you're stable, you're steady, and everything's fine. And to also make sure you have no clotting issues, meaning if they prick you, you will not bleed out. Because if you don't want to put those tubes down through and you start bleeding from there, it becomes a problem. They can't stop it. And then your primary doctor will also look at the medications you're taking. For instance, if you're on a blood thinner, they have to stop those blood thinner. You understand? If you're on a blood pressure pill that will decompress your blood pressure or raise your blood pressure while you're on stress, or, having those stressful events, your pressure goes up. You have to make sure you're off those meds. So that's why it's important you see your primary doctor before. And every good what do you call it, plastic surgeon who does your liposuction, guess what? Will need a medical clearance. A medical clearance from your primary doctor. Otherwise, they will not do it. Because if they do it, if something happens to you without the medical clearance, they're liable. You understand? So they will always want to put. If anybody say, "Oh, come, I'll do your liposuction," and you don't have a clearance from a medical doctor, run away from that person. That person is probably a quack. I'm sure, because they don't want you to get exposed to somebody else who would most likely, tell you otherwise. So, but once you've done with that, yes, you need to follow up with your primary doctor to say, hey, you know what, I've had this done, because he or she knows you're going to have it done when you come back. You'll have to check your kidneys to make sure, listen, none of those things that they did has thrown some clots that will go block the blood vessels to your kidney. Or your liver is fine because they didn't puncture your liver. Or your gallbladder is okay and you're not spilling, bile anywhere. And the blood pressure is good so far. Because again, liposuction is a serious, serious, strenuous event, and people should not take it lightly. Yes, follow up with your primary doctor after your liposuction.
As well as the surgeon after the liposuction.
Oh yes, of course.
Both of them.
Yes.
The next question, follow-up question is also, what can they take to reduce inflammation and pain? I think we're not establishing care on this forum. We're not establishing doctor-patient interaction. The primary care doctor and or the surgeon that performed the surgery will make that decision. Do you agree, Dr. Aluyah?
Yes, I agree. Again, stressful condition produces inflammation all around you. You understand? And that's why it's so important again to see your primary care before you go that. So once the doctor who you see will decide to give you pain medicine to help reduce the pain, however, pain meds, and your doctor as a follow-up would also decide that based on what they've seen observed in you as well.
Thank you. That was a good question. Thank you. And it's consistent with what we're talking about because, sometimes liposuction is needed. For instance, in some people who have lost weight through lifestyle changes, sometimes then they have that flabby skin that needs to be taken care of so that things look, nice and even.
Can I make a comment on that?
Yes. Yes, please. Go ahead.
This is Dr.
And can you introduce yourself, please?
Yeah, my name is Dr. Lukweju. I'm an OBGYN.
Dr. Ilukweju, sir. Good evening, sir. Welcome, sir.
Thank you. Very nice lecture. Touches on all the areas of medicine and all the strata of society. One thing I want to say, I always tell my women that, the biggest thing I'll put a number on you in terms of weight gain is having babies. So each time you get pregnant, you gain weight. And if you don't lose that weight before you get the next pregnancy, the next one will add to the first one, and then to the next one. And like I always joke with them, the next thing you know, you become a madam. So you have to try to lose that weight. The maximum pound that you should gain during each pregnancy is about 40 pounds, max. Like 1 pound for each week. That's what we say. And you have to try to lose it before the next one. So once you finish having all your kids, then you can then go for mommy makeover. And that includes losing weight. And just like Dr. O said, you lose that weight, there's going to be some area that will not have the belly. That belly, no matter what you do, just will not go. So that's when liposuction comes into place, to remove that excess fat so that you can look the best that you can look. So that's something I want to say. Secondly, in the beginning, we were talking about chronic illnesses, men and women. I always tell my women, men die before women, in most cases. So I tell them, men, we are so macho that we don't want to take care of ourselves. I'm okay, nothing's wrong with me. I don't have blood pressure. I feel fine. So I tell the women, because women go to see doctors more than men. Bar none. So I tell them, if you want your husband or partner to be with you for the long haul, to help you raise their children, then you have to be the one to take matters into your own hand. You have to grab him and drag him to the doctor. That is very important. So don't say, I'm seeing my own doctors. He can take care of himself. No, men die first. So if you want him to be around to help you raise those children, you have to. So that's something I always tell my patients. Thank you so much.
Thank you so much, sir. Great advice for women. We got to take care of the men. Dr. Aluyah, comments.
Yeah, I know that I've said that a number of times as well. That women should drag their husbands and bring them in. I've said that a couple of times. Now it's easier for female to go to, so women are more um, um, have a greater propensity or chance of encountering healthcare earlier than men or boys. And you can look back. Look, by the time puberty hits, you find out that most times it's the average, the same number of times that a male child meet the doctor, the same time number of times the female meet the doctor until puberty. Because at that point in time, oh, the child is not guarded. Oh, she's having a period. If she's having pain and the pain is too much, doctor. If she's bleeding and bleeding too much, doctor. If he's not bleeding at all, doctor. If you miss a period, doctor. You understand? Or the breast didn't come out on time, doctor. If it's getting too big, doctor. So you find out that the parent, especially the mother, and everybody expects the mother, not the father, to take the child to, because the mother also has, access and easy contact with the doctor. So that child is trained early. You know how to say, train a child the way it should go. When he becomes adult, he will not depart from it. So that's the training that women are giving to the girls. And on the other hand, the boys are not getting that. They're out there running and all that and all that. So if you miss a period, okay, doctor. You understand? A UTI happens for a girl, which is much frequent, doctor. You understand? Boys don't get UTIs that much. So all of those things, abdominal pain and all that, doctor. So that's why women are so much more, have an easier and earlier contact with a healthcare professional than men. So it's a habit that has started very early and it grows up even when they become adults. And guess what? Nature has it that way because women are the custodians of our inheritance. If the next child that's going to come into the world, the woman has to learn early how to care for herself, care for the baby, and nurture that baby. So genetics have programmed it like that.
On point. Thank you. So women, please, you got it. You got this. But take the men with you, or please connect them to care. We got to take care of those men. Thank you. Pastor Paul, kindly unmute, sir.
Yeah, thank you, Dr. O. Thank you, Dr. Aluyah.
Welcome, sir.
Yeah, thank you, ma'am. Yeah, in your presentation earlier, Dr. Aluyah, you alluded to sickle cell anemia. And I wanted to know if there is any connection between anemic situation in adulthood to sickle cell.
Okay. So most sickle cell, as you know, sickle cell came from those of the West African, particularly region because of malaria. You understand? Malaria was killing a lot of people. So genetically, our DNA modified so that we can withstand malaria. And this is a little caveat I'm going to add to it. If you look at Africa, right? If you look at Africa, north, east, south, white people occupied all of those places and they dominated, except West Africa. Why? Because of malaria. They could not handle malaria. There was no answer to malaria. They couldn't. And that's why when a lot of them came, they died off. So that same genetic predilection that gave us malaria and protected us socially from other things as well, the total subjugation. But then that's another story. Now, moving on. Most 90% of cases of a child born with sickle cell, because remember, there are different kinds of sickle cell. There's SS, there's SC, there's S-tau, the beta-tau, and all the other ones. Not to go into detail. But the one that we know so commonly is the SS, right? SS. Now, those ones, they often produce really early in life, usually 6 months. Because why? When the baby is inside the mother stimulate the baby's bones to produce a different kind of hemoglobin, the one that carries oxygen, right? That hemoglobin is called fetal hemoglobin. Now that lasts for 6 months. After that 6 months, the number drops because the oxygen of that fetal hemoglobin is up to 90%, right? Let's say, while the regular hemoglobin that you and I have can carry up to 60%. So at 6 months, when that number drops, you find that the hand begin to get swollen. They have pain and swelling in the hands. That's how you usually know early that the child has sickle cell. Now, as time goes on, they have the yellowness of the eyes, the bone pain, and blah, blah, blah. So we get that. Now, for some, they have pain in the stomach for the SC because of sequestration into the what do you call it? The spleen, right? Now, for a few people, if you look at Africa, there are different strains of sickle cell. In as much as you have the SS, there's the what do you call it? The Zulu type, there's the Cameroonian type, there's the Senegalese Bantu type, there's also the Arabian type. Now, of all the different strains of it, the one that's really, really bad is the Senegalese Bantu type. Those are the ones most of us have, I mean, in Africa. So those ones produce really early. Now, for some of the Arabian type or the Cameroonian type, they don't show up on time. I've had some people who live here who are African Americans. Guess what? They're up to 30, 40 years. They don't even know. I had to tell somebody and screen the person for sickle cell because over a while, he's 40 something years old. But the only thing he had was a wound in the leg. The wound wasn't healing. Now, how do I know? Sickle cell wound appears different from wound from diabetes, right? The sickle cell wound usually on the medial side of the leg, lower leg, and it's there. So because I know that, and I saw this guy with the wound, I was like, I asked him, have you ever been screened for sickle cell? He said, no. Do you have anybody in sickle cell in your family? No, I don't know. He's from Haiti. You understand? So I said, you know what? This wound that we're trying to heal and treat is not healing. In the position, it looked like somebody with sickle cell. So you know what? I screened him for sickle cell. Voila. He came back, he had sickle cell. He had no idea what sickle cell is. So a few times, people would have those strains that don't come with the disease so often, so you don't pick them on time. But when you see somebody has a kind of anemia, and the kind of anemia you can tell, the doctor can tell, there's what the MCV and the RDW. There's a structure and percentage that you see. Your doctor, that's why again, you can't overemphasize you sitting with your doctor once a year to determine all of those. So that they can look at those blood results like, you know what? Your RDW is really low. You're high, but your MCV is really low. So you have some kind of anemia. All right, you know what? Let's do hemoglobin exploration. And they can tell if you have sickle cell, and they'll tell you the type of sickle cell you have.
Thank you, doctor. You really elaborated highly on this. Very powerful. Thank you so much.
Thank you.
Thank you. Wow. There's SC, there's God help us. So I think there's another question in the chat box. Okay. How would you approach transitioning a patient from pediatric to adult medicine? And from what age should that type of counseling begin? That's an excellent question.
Right. I think we talked
I
about
think
that
you broached
earlier
it.
on.
You broached it some in the beginning.
Right. Right from the beginning, we talked about the transition, especially those with chronic medical disease. It's a discussion you begin to have at age 14, really, and say, you know what? Look, as the breast begin to show, as the voice begin to change, pubic hair comes to shell out, they're like, listen, you become an adult. One day you'll become like me, and then you have an adult doctor. Simple. One day you become like me and you have an adult doctor. And guess what? It's okay to take your teenage child to come with you to go see your adult doctor and see how they interact with you. You understand? So that, again, teach a child a way to go. When he grows up, he will not depart from it because he's already been exposed. You understand? And I often joke and I say, look, you have to teach a lion how to hunt. Otherwise, you will learn to hunt rabbits and cockroaches. Lion. So for you to do that, you have to take them along to show them how it's done. So having that discussion at age 14, and when you go with your doctor, have that discussion. You can talk to your pediatrician like, hey, you know what? Could you bring it up? You can bring it up with the pediatrician, doc. So when do you think this child will be able to transition? Pediatrician will tell you. Pediatricians are also nice, all of them. They're like, yeah, you're with me now. In another 4 years, when you'll be 19, I'll look for a good doctor for you. That's what they say. I look for a good doctor. You become an adult now. Maybe you're going to college and all that. That's a way of transitioning. And you can start having those discussions so that by the time the child is 19 or 18, they already know in their head, like, hey, you know what? I need to find myself a good doctor. You understand? And having that discussion, if they're on medication, they begin to write all the medications down. You have a list. If they're on a special diet, you have a list of the special diet and all that. Now, if you have a medicine pediatric doctor, it's even good because they see adults and children. So you just transition consistently, go on onto the next phase of their life. No, they don't, then guess what? You can also help get a social worker or a caseworker that will help you in the transition period. Insurance issues, medication issues, all of those things is something you have to help, the child. Just like a mother would prefer the child getting ready for college. The same thing, right? You have a discussion, you plan, you talk. The same thing you also have, get ready for puberty. All those discussions you also have.
And a family practitioner also will do the
Oh,
same.
yes, a family practitioner.
We
Yes,
just,
you're right.
go straight like that. But would you say they should transition at 18, 19, or sometimes 21? When does this transition?
Well, some people, some will say 19, they don't, or 18. You understand? They stop seeing anybody above 18. Some will extend it to 20, 21. Some has actually extended to 25. Especially for those, yes, some have done some that. They extended to
Really?
25. Yes,
25?
to 25. For some
Wow.
with history of what do you call it? HIV, some of them have extended it to, childhood HIV. They've extended it to, or some group of the LGBT group, because it's hard for them to transition to adult. So some of them will keep them up to that age 25 as well. Because they still want to get that, connections.
Nice. Thank you so much. This has been fabulous. Thank you. Medicine, mental health. And I pray that in our community, we remove this stigma from mental health so we can get treated. Auntie Tower, kindly unmute when you know that I was getting ready to close. Ask your question, ma'am.
Yeah, good evening, everyone.
Good evening.
Good evening, Dr. Aluyah. Good job.
Good evening.
Yeah, at Tampa General here in Tampa, we have some kids that came to have babies at 15, 14, 16. So what's going to happen? Are the mother and the child are going to be pediatrics, or the mother is going to transition to adult, or what happens?
Well, that child is still a child, is an emancipated child now, right? Because remember, she already have a baby, right? So she's seeing what? An OBGYN. An OBGYNs are male and adult doctors, right?
Yes.
So they already have contact with an adult doctor already. And at that point in time, having a child, she's also an emancipated child or adult or whatever you call it. So at that point in time, yes, they can transition to going to see their adult doctor. But however, some of them still prefer to see their pediatrician. If they still want to see their pediatrician, fine, because they still need that nurturing and the cuddling and care and tenderness that a pediatrician will give you. Adult doctors don't do that. They really just don't do that. But pediatricians will do. So again, it's still a preference if she wants to stay with her a pediatric pediatrician because she's still a child. In as much as the emancipator can still continue, and now he will see the child and the mother, so which is pretty cool as well.
Thank you.
So thank you so much, Dr. Aluyah. And Auntie Tawa, that was an excellent question. Excellent question. Dr. Ilukweju said for women, once the girl reaches menarche, it's time to switch from peds to adult. Really? Dr. Aluyah. Dr. Aluyah is med peds. So excellent. This is his forte. This is his territory.
Well, you know the world we live in now. These 14-year-olds or 12, 13-year-olds, they are taller than all of us anyway. You know that. That's
Yeah.
what. But they're taller than all of us. And guess what? At age 12, they are attending menarche, right? So
Yeah.
their body's big, they're adults by size and structure, but mentally they're still children. You understand? They're just learning the process and all that. So there'll be huge confusion. Their child's already confused with the process, the body changes that are taking place. So having to see them an adult doctor, no. So they'll still continue with the pediatrician. They're still young until, again, that's what they call a transition. It's a process. It's a process that should take nothing less than 2 to 5 years, really, depending on whether the child has no medical issues or has chronic medical issues. And you have to tailor it to the child, see where the mental state of the child is and all that. We have um, um, children who have developmental delay, right? And they become 32 years old, but they're still like 15. You understand? So switching them to an adult at this stage is really difficult. So, and they can't handle it. You see them throw tantrums and all that. So they still stay with their pediatrician until it's time enough to really transition. Because otherwise you're just going to lose them. And a lot of them will die. They don't go to see the doctor, and the medical problems just, escalates, and they have multiple complications that take their lives.
That is the truth. It's really age more so, and like you said, sexual orientation and stuff that we use to transition them. We don't transition when a girl reaches menarche.
Dr. Lukoju, I beg to
Yes, sir.
disagree.
Go ahead, sir.
Yeah, I beg to disagree.
Really?
Yeah, of course.
Go ahead.
Yeah, because I get a lot of young girls being referred to me by PIPs. Once a girl reaches menarche and the body begins to change, the menses begin to change, irregularity of menses, abdominal pain, all those things. The PIPs cannot manage them. That's a time that's a time to really refer them to a gynecologist. It doesn't
No,
have to be
sir.
it doesn't have to be a PCP. Yeah, but a gynecologist, just like Dr. Aluyah was saying, hello.
Go ahead. Go
Yeah,
ahead.
just like Dr. Aluyah was saying, you need somebody that's going to really understand what it means that this is a young person. He needs a lot of tender loving care. He become the psychiatrist, he become the gynecologist, he become the everything to that young girl. But you need somebody to start talking to them, because I believe I had some 12-year-olds in this country before.
Yeah, sir.
Are you with me?
Yes, you are.
So basically, that's a time to really transition that girl to gynecologist, because you have to talk about what it means to be a woman. You have to talk about what it means to get pregnant. You have to talk about about contraception. If they have any medical issues, maybe the PIS can continue to follow them as well. Like obesity, childhood hypertension, but they also must be referred to a gynecologist. Thank you.
Sir, your point is well taken. We were talking about when to transition from pediatric to adult medicine.
Right.
That's what we've been talking about tonight. Now, when it comes to OB and GYN, which you are specialists of, that's a different ball game. They can come to see you anytime. Once they reach menarche, yes, they can come see you. They're not ready for pap smear because the standard now is that we start pap smear at the age of 21.
Yeah, but it used to be different.
It used to be. Yeah,
Yes.
I'm talking about the new standard.
I know. When I was in training,
yes,
the yardstick for pap smear is once a girl becomes sexually active.
That's right.
Whether it's age 12 or 13, 2 years after that, you must have your first pap smear. Obviously, we know that's no longer. Your first pap is at age 21, and the rest is history. Thank you.
Exactly. So standard of care now is that pap smear is at age 21. But as far as menarche is concerned, if the parents decide to see a GYN at that time to be the person to talk about menarche and breast changes and stuff like that, then, they can do that. But they are not ready to transition to adult medicine. Dr. Aluyah, you are med peds.
Yes,
Kindly,
yes. So
kindly comment on
have
that.
I sent people to go see OBGYN? Yes, I have. When they have issues, there are things, there's a couple of reasons why you send people for consult, right? One, you send somebody for consult to go figure out what you cannot figure out. That's one. Two, you send somebody for consult to help you figure it out, not just figure it out, but also even if you figure it out, to help you co-manage, right? So that's the second reason. The third reason is, listen, I've managed this case. I can no longer hide, my hands are full, or I don't have the expertise. You take over control. So those are three reasons. Now, as a pediatrician or adult doctor, there are times when a child would move from menarche to adult, never saw OBGYN until when it's 21 or there's a problem. You understand? But otherwise, a transition to an adult doctor is when that stage of 18, 19, 20. That's when you begin to do that.
Yeah, that is standard. But Dr. Lukweju, don't worry. When they turn 21, you make sure they come to you.
And
Guess what?
no,
I do pap smears. I won't send them to you. I take care of mine. They won't even come.
but I mean, you can do. Some of the women I deliver their babies, they're the one that bring their daughters to me to say, okay, talk to them.
Which is
I mean,
great.
it all depends,
But
we can co-manage. That's what we're talking about, co-management. That's what
absolutely.
it is. When there's a problem that you cannot manage deeply, and then that's time to say, okay, like you said, rightly so, Dr. Aluyah rightly said, then send that person to the GYN to look into it in more depth. That's all.
Yes, and we always do that because we do respect our specialists. And like Dr. Aluyah said, sometimes, a lot of times we can manage these things even, but we don't want to because we want to focus on primary care. We want the specialists to handle it. And we appreciate what you do. Absolutely, yes. But we will continue to manage those girls till they're ready to transition to adult medicine because it is different. And it should be done with care, like Dr. Aluyah rightfully advised us. But thank you, sir. We will continue to refer to you.
Yeah, no, it's co-management. That's all.
Yes.
We are doing the same thing, just to bring them up the best way we can.
Yeah.
Right.
Thank you, sir. Dr. Fawale, good evening. Kindly unmute. You have your hand raised. Dr. Fawale, kindly unmute.
Oh, okay.
Yeah, thank you.
Thank you. Thank you. Good evening, everyone.
Good evening.
Thank you, Dr. Aluyah. It was great hearing your voice today. It's been a minute. Dr. Aluyah is my doctor, that's why.
I knew that. But it's okay for you to let the cat out of the bag.
All right. But I have a question about the place of counseling or therapy. Since we're talking about chronic illness along the line of mental health. So I don't know, maybe you can shed light a little bit on that. I know that maybe counseling therapy is like a taboo in our community. So is there a time that medical doctors recommend therapies or therapy for their patients when they see it as a need? Or is it something that patients have to figure out and find?
No, nothing a patient has to figure out. None.
Okay.
I'll tell you that it's like they say, it goes pari passu. Let me speak a typical Nigerian language. It goes pari passu. And in all sincerity, once a child has chronic medical issue, that child at one point or the other, as from age 10, begin to, again, it's still, child dependent. You have to look at your child, see what's going on. Is there issues of depression? Is there issue of withdrawal? Is there issue of other issues as well? I mean, some of these children, they have bedwetting. You understand? Bedwetting can be a chronic issue for children as well. So that's a chance to look for a child a psychologist or child psychiatrist. They have them. That's a specialty in its own. They do 2 years of pediatrics and then move on to psychiatry and become a child psychiatrist. So that's the time. Now, the best thing really for any child who is in that level of transitioning without any medical, with chronic medical issues, I think every one of those child with chronic medical issues need to see a child psychiatrist or child psychologist to help them. Even just to have a discussion. You understand? Let that person just sit. Because look, there's no child with chronic medical issue that's hitting puberty with no big issue of adjustment. And that's why in diagnosis you have anxiety with adjustment disorder. It's a diagnosis, right? Depression with adjustment disorder. It's another diagnosis. So they have those adjustment issues. And as you, as a pediatrician, can't handle that, you send them to go see a psychiatrist or a psychologist where they just sit and talk. One of the biggest issues we have in our community is that, oh, we're afraid they're going to put my child on medication. Listen, not all the time. But guess what? Bless you. If your child needs medication, yes, they need to get it. I'll give you a typical example. Children with ADHD. Look, one of the biggest issues, the service you can ever do for a child that has ADHD is not to give that child the medication that they deserve. Period. And in our community, we're afraid, oh, they're going to put my child, they're going to put my child. Look, the ADHD child's brain is functioning in a different level. And the neural excitement or firing is very different. You need to calm those things down. Because if you don't, at age maybe 4, 5, 6, 7, 8, 9, 10, guess what you're going to do? They try as much as hard they try to, especially sit quietly and read and learn. They can't. If they cannot, the next thing they begin to tell themselves is, because they'll be failing in class, I'm dumb. Another children will call, oh, you're dumb. You're stupid. And that goes in their head. They're not dumb. They're smart as hell. But guess what? They cannot just sit still so that they can concentrate and be able to learn. I've had to do that for a few children. There was one who was having serious problems. Child was failing out of school and all that. And the mother called me. I said, look, we need to have the discussion. Your child needs to be on meds, period. During school season, the child will take the meds so that they'll be in school and sitting down and learn so that the child can learn. Brilliant, brilliant. Off school season, then you can take that child off the medication and then they can do whatever they want. But when it's time for school, you put them on. Guess what? Changes. The child became the best student in their school. For the child who was failing, I've had multiple examples like that. So our community, like, oh, I don't want my child to be on medicine. You're doing the child the greatest disservice. The child cannot learn and we think it's stupid, and then it becomes a problem. Then truancy comes. Well, opposition, defiance, whatever. All of those, childhood, what do you call it, neuropsychiatric problems begin to emanate, and it becomes a problem for you. So it's important to do that. Now, on the transition era, every child who's transition with chronic medical issue need to at least see at least once in that process, a child psychiatrist and a counselor, so that it will help them adjust properly as they transition.
Yeah, and also, Dr. Aluyah, you couldn't have said it better. And with the ADHD, they can even take weekend holidays.
Right.
They can have a break from the medication. It is important so they can have the right foundation and be set up for success. Very important. Thank you. But I want to add, Dr. Fawale, that even in adults, we don't leave it to patients. We identify, we are the gatekeepers. People like Dr. Aluyah and myself, we gatekeepers. We are the first stop. We're the first ones that that patients come to see. And sometimes patients come for other things and we identify right away that they have depression.
Right.
So we make a decision if we are going to treat them, at least start them on treatment, refer them, and what next steps. We are the ones who refer to specialists. We respect our specialists. We know our limitations. It's part of being an excellent doctor when you know your limitation and you know when to refer. And we do. So we point the patients in the right direction. We beg, we educate, especially our people, because of the stigma against mental health. And sometimes when we make these diagnoses, they are resistant to care. but we do our best to make sure we get them to the right care. That's a great question. But we are the
But
ones
thank you.
who actually initiate that.
Thank you. I think the awareness still needs to go on because I think a lot of maybe African men, if I can say that, maybe not all, but majority, we resist counseling. It's something they don't want to do. You recommend it for them, they don't even want to go because they don't see the reason. So I think I want to thank you for recommending it. So hopefully, the more we're hearing it, the better we're going to become, the better informed we'll become, so that we can take advantage of it.
Yes, thank you. Thank you so much for pointing that out. Counseling is excellent. My counselor is on the forum right now. I'm not going to tell you who she is.
Good evening, everyone. This is one man.
Good evening.
Thank you, Dr. Aluyah. Look, with the medication, please advise them to go for therapy also. Combine the two together because the medication alone, it's good, but they need therapy. I strongly advise that. We should remove that stigma. The brain is an organ. It gets sick just like every other organ in the body. Just as we take care of our physical being, we should also take care of our, mental well-being also. Very, very important. So that's my little take on that. Thank you
so much. Thank you. I
You're
appreciate you.
welcome.
Thank you.
My pleasure.
Auntie Tawa, kindly unmute.
I think there's a question from Brazil.
I know. But the people who raise hands have preferences.
Okay.
Why? Yeah. Auntie Tawa, did you?
Yes, I did.
Oh, okay.
My question is, how did we survive, the people of my generation? Because all this counseling and everything, we didn't go through any counseling, and we went through all kind of stuff, and you just have to swallow it, and with your body, you just have to do what you have to do. Nobody takes you to anybody to see a counselor or do anything. And we went through what most of these kids are going through too. So what happened to us at that time?
What happened? You see, the life that you lived is very different from the life these kids are living. And I alluded to it earlier on that women in those ages, before the white man came, we have a structure process of graduating from stages to stages to stages into motherhood or into femalehood, into motherhood and all that. And for women, you have a lot of help and the community, because we're very communal. They're very supportive, they strengthen you and all that and all that. The same thing for men. Now, when the white man came, they destroyed all of that. But remnants of those happened. And I'll tell you one of the remnants is this. When you do something bad outside and they see you beyond your scope of the street that you're supposed to be walking on, you dodge from your neighbor, right? When you see Mama Felicia is coming on the street, you dodge because if she sees you, she'll pull your ears, right? Even before your mother knows. And she can even whoop you right there and there. What are you doing, right? Before your mother, and then you beg her not to even tell your mother, and you take the whooping from her. Because if your mother hears that you saw her somewhere and she saw you, and they'll ask if they whoop you or not. If they say no, then you have a better whooping at home. So those are some of things where we had communal and collective care for our children and our community. And we played. Look, we played outside. I remember playing soccer. Some of the places I went to do for soccer, play soccer. If my parents knew I went there, Lord have mercy, they'll have a heart attack. You understand? We went out, but we went to play, and we all came back as a group. And when you come back, your mental state is intact and all that, and you come home. Look, then there was contentment as well. We also have ruined our children. I'm sorry to say that. Look, when you were growing up, for some of those who were rich and some who didn't, you find out there was one TV in the whole street. It was black and white box, right? The black and white box. Guess what? The one person who had that black and white box had that black and white was probably for 5, 6, 10 years. Nobody else in the street had the TV. Because you know what? They didn't have the money to buy it, so they're not going to steal, or their wives were not pressuring the husband to go buy TV. So everybody gathered, the children gathered at the window, watched, and there was contentment. Now look at home. You cook the food at home. Listen, we're eating eba and what do you call it? Egusi soup tonight. How dare you say no, I don't want to eat that? You understand? You eat what everybody's eating in the house. Today, every room has a TV. Every child, they want their own TV because they want to watch their own TV. And it starts from little babies. You understand? Or a child comes and dominates the TV in the house. You move from living room to your bedroom, the child comes there and wants to dominate the TV. Right? That's how the sense of entitlement begins, really. And that's how we began those things. And then, oh, I didn't get all the things that I needed to get when I was growing up. Who told you that? Right? Who told you that? Oh, now there's iPad. Oh, every child has an iPad so that they don't fight. Where's that connectivity, a convivial relationship that you and your siblings had when you were growing up? Where you sat down and watched TV, one TV, where you sat down and played with one toy, where you sat down and did two together, where you sat down and ate on the same plate. I tell people this, it is okay to be civilized. You don't have to be westernized. Two different things. It is okay to be civilized. You don't have to be westernized. Where you don't teach your children how to speak the language. Oh, I say, Levi, you can't speak. Oh, because you speak with an accent. Who cares? Let them speak with an accent. Because it gives them a sense of identity and self-value and self-respect. And that's why they can go around and hit their chest and say, you know what, I'm Nigerian. Thank God for, what do you call it, Afrobeat. When we came to this country, a lot of these children didn't want to identify as being Nigerian or even African. They didn't want to. You bring the food, they don't want to eat it. Now you see, social media everywhere. Afrobeat, they identify, I'm Nigerian, proudly Nigerian. You understand? Because they have something they can identify with. They wear the clothes. They eat the food now because they see white people eating your food. It never used to be like that. So these are some of the things where we lost our way. And because of all that, we lost what they call resilience. When you're growing up, how many children did you see commit suicide? Or even slash their wrist? You never heard of that, right? But now you begin to hear of that because guess what? We raise our children all in isolations, right?
So I got this country. I don't know.
So, and again, I said, you don't have to be westernized. In your home, like the Bible says, as for me and my family, we shall serve the Lord. Guess what? The Jews are doing it consistently. They don't care what the system says. They really don't. Some Indians are doing it. Others are doing it. What the heck is wrong with us? Which is so brainwashed to the point where we lose our value, we lose our structure. But thank God things are changing, and we should pick up the good things of social media to help train our children, give them self-value and sense of respect and dignity.
Hey, Dr. Aluyah, that was deep. That is so true. So true. However, mental health has been there too during those times. I remembered growing up that you see someone goes psychotic on the streets and they'll call them witches, start throwing stones at them. Antitawa occurred. There were, before marriage in Yoruba land, at least I know this, they send people to go investigate if there's mental health illness in that family before they will give their daughter or allow their son to marry from there. So there were mental health issues, and there's always been stigma against it. There's more awareness now. We diagnose more. We have better tools to diagnose. That's another caveat. But, to just add to what Dr. Aluyah said, though, I don't know if you've noticed in restaurants, you see families sitting down at a restaurant and everybody's on their phone. Nobody's talking to anyone. I've sat in restaurants and watched this. This never used to happen. When we sit down to eat, it was time to, get together as a family and break bread. A lot is being lost from our culture. It's going to take us to rebuild. And that's why we're having
I've had families where, unfortunate, look, this guy would just get up or the girl would get up and like, oh, I'm marrying this person. The parents don't even know who this person is, don't know Jack. And then when they call the child, she doesn't pick up the phone anymore. You understand? And I'll tell you this, in all sincerity, growing up, all through till I went to medical school, thank God it was a little cheaper, I was dependent on my father. No, I'm serious. My father paid every single thing back home. Now we get to a point here in this society. Look, you see, I love going back. And I love going back, and we have to have this discussion because some of us will become what? We're adults, we're having children, and we're going to become grandparents. When you're raising your children early, you're having children early. Look, at that point in time, at the baby age, first day, 2 days, 3 days a week, start putting your money aside for college for them. At that stage, $20, $30 in 15, 20 years will amount to something. It's a cumulative amount. And as time goes on, you begin to get more financially buoyant, you can add more to it, right? So that by the time they get to age 18 and all that, you will tell them, listen, I'm sending you to college. I'm paying your college fee. Thank God a lot of us still do that because that's one of the biggest hold you have on your children. Look, by the time you tell your child, go figure this out. I'm training you. Go, what do you call it? Get student loan. Not that messy. What do you have over that child anymore? Nothing. The child is spending for herself. You tell them to sit down for heck. Why? You understand? Or some of us have our children. They live in the house. Okay, fine. You want to look? I never worked until I was what? When I finished medical school. How many of us worked in back home? Even if they had jobs, your parents would not allow for what? What are you looking for? You understand? If you want to give your child, I allowed my child to work. But guess what? She worked the 2-3 hours a week or whatever she did. Whatever she did with them, she and her mother decided that. You understand? I'm not asking her to give me money to help pay the house rent. We do that these days. You understand? When you begin to ask your own child to contribute to the house, for God's sake, how much respect do you think that child will have for you? You understand? How much? If you have a chance to buy a car, fine. If you don't, then share cars with them. When they start driving, okay, you now have, here's a drive, take me to work or take me, period. Because you have to have an attachment to your child so that you have a value and a say over that child's style and living. So that when that child goes, if that child's from 18, 16, 17 doing things by herself, and you want to get married, you can tell me who you need to get married. You think she cares or he cares? He doesn't. He don't. So now that's that. For grandparents who are on the forum, when your child is having children and babies, listen, because at that point in time, they're still struggling. They're still trying to feed their parents. They're still trying to raise money so they can pay down mortgage for mortgage. They're still trying to do all the pay student loan. You don't have student loan. You've raised all your children. The little amount of money you have now, even if they don't have the $20 to put aside or $30, $50 to put aside for their children, you, grandma, grandpa, put it aside. Put it aside for them in the name of that child. So that by the time 20, 30 years, in 10 years' time, your children will a whole lot more buoyant. And then guess what? They can now add to that money that you've been putting aside. So by the time the child turns into age 18, there's money already for college. God forbid you're dead, the child will still go to college.
No, there's a college account.
You still go to college. And
there's a college account.
You understand?
There's a college account to put it in.
Right. So the accounts, right. So that's how we have value so that, and that's how we build generational wealth. Other people are doing it. We don't do it in our community. I don't know which big giant house you're going to build at home as a grandma, grandpa, how long are you going to live there? For how long longer? You understand? These are issues in our community that we must begin to have discussions about so that we know how to hold account our children, put an attachment to our children. And that because look, at the end of it all, it is not necessarily what you do for them, it's how you make them feel. And with everybody, we must begin to have the discussion. And I'll say thanks.
Thank you. And you're right on point. You're right on point. It also helps their mental health.
Yes.
And they don't have to worry about money for college. I'm going to ask this question really quickly, and then I'm going to go back to the hand raised. From Chika Emmanuel. from Brazil. It says, how do the current social generational changes influence traditional medicine decisions in young adults?
Well, look, we have TikTok and all this other stuff now. I said it earlier on. You can be friendly with your children, but you're not their friend. So what does that mean? Look, when I was growing up, we had TV. I sat and watched TV with my father. I watched movie. One of the greatest things I think about, I remember my father.
Bonanza, Village Headmaster.
Yes, but I watch movies too. The movie called The Thing. The Thing. It's a movie of some alien, in Attic that came. I remember that well because every time I see the Thing movie now, I remember my dad, and those are fun times. I remember him fondly. You understand? I don't remember the school fees he pays for me anymore, or the other things. But the few times that we spent together sharing times and laughter and all that. Those are the things I remember back in. Because you know what? Your children will feel that's your duty. It is. They
So,
didn't ask to be here.
but how does it influence the traditional medical decisions?
Right. So,
in young
again, when
adults?
it comes to that, there's social media, there's everything else, there's medicine, but there's still the common sense of a home. How do I say that? Listen, at the end of it all, it's still a unit of a home, a unit of a family. And like I said earlier on, it's okay to be civilized. You don't have to be westernized. If you have diabetes, if you have chronic medical issues, all your children have that talk and say, look, my children, I have diabetes, I have chronic kidney disease. The kidney disease I may have inherited from my father because it's true. We inherit these things. I may have inherited this. I'm telling you now so that you will also be know so that the mistakes that I made, maybe the alcohol I drank, the cigarette that I smoke, or the risk that I put myself that gave me cancer, you also do not have that risk. So you mitigate the risk by having those discussions. Now, how does social media and modern times help? Look, as a parent, I talked about 5 technologies earlier on. You also have to learn those technologies. Your children at this stage, they're busy reading their books or whatever. They don't have to stand. Some of them will, but they don't have the time to learn about AI. They don't have the time to learn about all of those things. As a parent, you YouTube those things, read them, hear them, listen to them, so that you can come teach your children as well. Have you heard about this? I remember my child. She was 8 years old when I had a discussion with her about special K. What is special K? Special K is ketamine. What ketamine was doing to the human body as an addictive medication. You understand? At age 8, it was big and all that. At age 8, and the thing she saw, like, oh my God, Dad, I will never do drugs. And I say, you're right. You understand? But we watched it on the media. You get what I'm saying? So those are the things, and I said it earlier on. We can use the good things of social media to educate of ourselves, educate our children, safeguard our family, uplift our family, and project the good image of our family and our culture. That's what social media can help us do.
Fantastic. Dr. Aluyah, I still have lots of questions, so I'm going to ask that we.
Okay.
Dr. Ajagbe, kindly unmute. Dr. Ajagbe, I thought Dr. Ajagbe raised his hand.
Yeah, I did. Well, I try to bring some light to some things. When it's mentioned, like the bedwetting and ADHD, yes, there's room for counseling, but there's at least 30% of the population of children diagnosed with ADHD and bedwetting that actually have sleep disorders. They have sleep disordered breathing, and once the sleep disordered breathing is managed, they don't need any medication, they don't need any counseling, everything reverts to absolute normality. So, before children are put in on medication long term, I think it's best at least to do a sleep test. Do a sleep test, particularly if a child is a mouth breather. They have had issues with tonsillitis, adenitis, and all these other breathing disorders along the way, make sure at least, this is why we talk about interdisciplinary, collaborations in managing children or any patient at all, particularly when we have, issues that might require long-term medication. It is best to find out what may be causing it. Now, I've seen a lot of patients that do have sleep disordered breathing who are children, and the primary complaint was bedwetting. And once their oral issue is controlled, is addressed, and the airway is opened, then they do not wake up. They do not wet their bed at night any longer because they can sleep through the night without any kind of interruptions in their breathing. And we know that once the blood oxygen concentration goes almost to the level of 80%, the child is on the verge of dying. So the airway is a very, very important aspect, particularly when a child has upper airway restriction syndrome. These are things that most times are overlooked, because once they say the child has a behavioral problem and all of that, the next thing that will be put on the docket will be for the child to see a therapist, and then medication and all this stuff. But I think it would be ideal, at least for anyone who is having such behavioral issues, to be investigated for sleep.
Thank you. Excellent point. Thank you. Primary care physicians will take note. Med-peds will take note. No, it's true. Thank you, Dr. Jagwe, for that very important reminder and contribution. Thank you. Tibena, kindly unmute. Our doctor in the making, kindly unmute Tibena. Kindly unmute. Okay, when she's working on that, I'm going to call on AI. AI, thank you.
Have you had a section on pre-diabetes and diabetes before?
Yes, we have. It's on YouTube. If you search Medical Mondays with Dr. O, we've had a few times. Yes.
Okay,
we still have again. We will again, because we 2025 we go back to refreshing.
I was close because the A1C they use for me is the one for the whites. My understanding based on my research is we Black Americans, Africans can higher. Our A1C is higher. Then the Latin America is next, and the whites are very low. And they use the one for whites, and I told my doctor, Dr. Kuti, she's a Nigerian, said, give me 3 weeks. And after 3 weeks, I went there, they check everything 2 years ago. And I'm still not telling her what I did. Because I'm an industrial hygienist, the glucometer they give to the patients, I don't know whether some doctors know how to use it or not. I started by testing every food I eat. I'll eat banana today. 2 hours, I'll check my sugar. 4 hours, I check my sugar. That's what I went through different food items I was eating. So within within 2 months, I was able to know what causes my sugar to go high and low. And after 3 months, this is about 3 years ago. So my own experience is everybody has to read about it and figure out what is causing your sugar to go up or down, because every human being, the way your digestive system works is different.
Dr. Aluyah.
Yes, absolutely. You see, one of the most profound thing you did was intervention. You took action, period. And that's what we're asking everybody to do at one point or the other in their lives. Take action. When you hear something that is not palatable to you, or that's detrimental, or that's going to cause you problem in the future, you take action, right? If you're writing an exam, you prepare for an exam, you fail once, you take action, right? Whatever you do, you take action. So you took action, and as definite as it is, yes, and that's what you get your result. The most important thing is in 3 years, you stay the same, meaning you remain consistent. That's another thing you must do. You take action, you stick to it, and you remain consistent. Like you said, everybody's different. And I always said this. You eat an egg, you're fine. No problem. I eat an egg, I end up in the ICU. Does that mean eggs are bad? No, they're just bad for me. So I have to know that eggs are bad for me because my body can't process it. Otherwise, I end up in the ICU. So I stay away from egg. That, again, is taking action. So you did the right thing, and that's the message we're pushing here.
Fantastic. Thank you so much for sharing that, and look forward to the next session we'll have on diabetes. But what you did was very smart, because you were able to identify the foods that raise your blood pressure, or your blood sugar rather. You were able to identify them by eating and checking the glucose and then managing that. That is fantastic. Thanks for sharing. Maybe somebody else on the platform may be able to take that advice. But please stay tuned for our next session on diabetes and pre-diabetes. Tibena.
Yes, good evening, everyone. Can you hear me?
Good evening.
Good
Welcome.
evening. Great. I just wanted to speak on a point that I heard a little earlier. I'm not sure who asked the question, but it was referring to why is it that kids nowadays face a lot of things and react to a lot of things differently than when others were young, when we were younger. And the reason I wanted to speak on this point was I was speaking with my little sister one time, and simply she just came up to me and she asked me, why is it that you say you burn a CD? Like, do you go and light it on fire? And I thought it was such a funny question because I'm like, no, this is, I explained to her what burning a CD meant. But in that moment, it let me realize how much the younger generation had not experienced a lot of these things that were very much quote unquote that we have seen and just known all our lives. And that was just one example, but it kept happening in such a way. Like she asked, why do we say hang up the phone? We're not hanging it anywhere. Meaning she had never interacted with a landline that had to be hung up on the wall. And to bring that back to medicine, it just made me notice how the jump, the exponential growth that the generations have faced and how different they can seem is a lot wider of a gap than it's ever been before. So now talking about why is it that they don't react in the same way that we do, or why are they facing a lot more of these things than we did, it's truly that they're in a whole new generation. So I had to sit with her and ask her, what does she think this is? Explain to me how she's seeing the world. So I think a good thing for us to remember, even myself becoming a future doctor, would be to meet them where they are, because I will only have my point of view on how I see the world, and theirs could be such an exponential difference in a point of view of how they see the world that we have to take the time and listen and understand, even as crazy as it might sound to us, what their realities are so that we can intercede whilst being alongside their realities, but also bringing it back and grounding it to the foundations of medicine.
Wow.
Mm.
Thank you so much. Wow.
Well, that's the beauty in medicine when you talk about continued medical education, right? Because you do that so that you learn some of the latest things that are coming in the future. Me being a professor, I teach my young ones and other doctors. I said, look, in the future, doctors will have to learn how to code, right? Because AI will have to do anything. So you must have to learn to code to tell the AI to do the things that you want to get done. And that's the future. The biggest difference, like I said, exponential differences in information. Information is the key and it's big, right? Now, their generation, there's an information overload. If you pick up what do you call it, your phone now and get onto one of those social media, the information you get coming at you, it's unbelievable. So you have to learn how to sift those, how to filter the ones that you want that are value to you. And that's why some people, they spend so much time. You spend so much time like, oh my God, you don't even know you spend this amount of time on social media. You understand? Reading or doing stuff. And sometimes you'll be shocked how some of our folks sit down and just watch this video back to back, back to back to, and some of them are useless and they dampen the brain. You understand? Listen and learn good things that will educate you. And that's why when I said earlier on, I said, look, as family, we need to also learn this technology. We talk about the 5 technologies earlier on: AI, blockchain, 5G, and the next G that's coming out, mRNA technology, and artificial intelligence. So these are the things those are things you have to learn. Because if you don't know that, how the heck are you going to teach your children or those who come in behind you? And like I always say that a lion does not learn how to hunt, will learn how to hunt lizards and cockroaches. God forbid, you're all lions and lionesses. You must teach your cubs how to hunt. Because we live in a world that's so different right now. And you have to be educated, and that's what it means.
Thank you so much. Thank you. AI, kindly unmute. I think you have something to add to this or say about this.
Okay. Are you guys familiar with prompt engineering?
Prompt engineering?
Yes.
In what context?
Yeah, in what context?
Okay. I had a background. Let me give you a quick background. I have 4 master's degrees, and I also became a computer programmer. Now, when you ask WhatsApp, you see AI on WhatsApp.
Yes.
Prompt engineering, it teaches you how to ask questions. So when you ask the question, if you know how to write the question, the AI will write the question and give you the proper answer.
Right.
So I was able to do it in 3 days. And that's the new thing, that if you have young guys in your families and the rest, let them look into prompt engineering so that you can be able to communicate with AI very well. If you don't learn prompt engineering, it will give you the generic answer.
Right.
So that is it. So when you're asking AI the questions, it's good to give it some facts you know. And that will more or less, you restrict it, you give it certain facts. So when you take that class, I took it for 3 days online. And if you do it after that, you'll be able to communicate well with the AI and get the correct answer instead of getting generic answers.
Right. Well, that's what they say with computers have
Thank
an
you.
issue. Garbage in, garbage out. So if you put garbage in, it'll give you garbage out. But the beauty is, these are young Gen Z. They're so far ahead. They know all these things already because they teach them really early from the beginning. They're so good. Even as much as I'm good with technology, when I sit with my daughter sometimes like, geez, she's so far ahead of me. But some of this she already knows, you know? So they're pretty good.
Thank you so much for sharing that.
Okay, one quick comment. I'm 73. And because I have the experience, I know how to add good questions. And my young kids, the 2 boys, they can't, because I have to explain to them so many things that if you know the process of doing your job, it will be easier for you to use the prompt engineering like a teenager who doesn't know anything about your job.
Well, you're the good lion, like
Thank
I
you.
said. Thank you.
Thank you. We appreciate you. You don't sound 73 at all.
I know, right?
It's very impressive that you are at the cutting edge. Thank you. And we all need to be. Appreciate you, sir. Thank you, sir.
You're welcome. You're welcome.
Yes, sir. Dr. Aluyah, I had told you I have a lot of questions, and they're very important. This one says, Doctor, could you please briefly discuss the mental health issues related to peri and menopause and the best ways to address them.
Right. So I actually gave a huge talk on
Mental health. Yeah, this is huge. This is a subject. This is
it's
a
a topic in
in
itself.
itself.
I gave a talk on this one time, and I'll begin to say this. And I'm sorry, I'm going to say this. The menopausal period are the most dangerous times of a woman's life. Period. The most dangerous. You know why? Because the body is changing and rapidly changing so quickly. The things that keep a female being female, the hormone is dropping, and that puts her at a lot at risk. And that's why at that stage, they have the hot flashes, they feel hot, they feel cold, and whatever. What's happening is the body is on chronic inflammatory state, chronic. And because they're in a chronic inflammatory state, even the blood vessels that they have are also chronically inflamed. So the changes within the walls of the intima or the walls of the blood vessels begin to thicken, cholesterol and debris form, and blah blah blah. And that's why, if you notice, look around. Most women who have heart attacks often have it around that period or just after that period, consistently. And that's why, because of the whole diverse inflammatory, changes that's taking place. So also with that, of course, when you have hot flashes and all that, like I said, with the pregnant woman, the same changes of inflammation are taking place in the brain as well. So the natural products, that other things that the brain produce, that some of us, we know that yet, they're still encoded numbers, the CP24, MP57, all of those things, that they're still looking to giving the names of what, that women have that make them live longer than we do, and begin to deteriorate. So that also affects the mental state. Reduce oxytocin, adrenaline surges, and all that. So it's a real confusing state in a woman's life. So at that point in time, what do they do? Well, I'll tell you this, and I'll tell you some of the things I've done, and I do it constantly as well. Back in the days, we tell women, okay, look, you exercise, it does help, because again, what does exercise do? Exercise increases your nitric oxide, as we already know, increase the blood flow to the same centers in the brain and to ovaries, to at least give it a crazy amount of blood supply so that they can at least survive a little more until you cross that age. Some people it works, but a whole lot of people it doesn't. Now, what have they done in the past? They give them combined pills, right? Oral contraceptives, right? Estrogen and all that. Now, the long-term estrogen use has shown to increase the risk of cancers, breast cancer, ovarian cancer, and all that. So, and that's why some people will take those medicines, blah, blah, blah. And then because of the fear of perimenopausal symptoms and all the problems that they have, they don't want to stop it. What I often told people is this: if you've taken those combined pills for at least a year to 2 years, you need to stop. You have to. Because if you take, the risk of having breast cancer, ovarian cancer quadruples. So you have to stop and have what they call a washout period, where the whole thing is out of your system completely before you can restart again. But that's a discussion you have to have with your doctor. Now, on an elemental level, for some of these I've done for some women, one of the things I learned a long time ago is the use of omega. And they begin to use that now. I have been using omega for 15 years. You understand? And back in the days, I used to do omega, the pills are a little big, right? So I used to do omega 1,000 milligrams 3 times a day. But how many people can take it? But when you're having those menopausal symptoms, because it's still very natural, right? As much as omega-3 fish oil. What it does is it puts so much overload on one of the pathways, right, of the adrenals that produces steroids for you. But because it's so big on that, there's a bypass to where they can produce your own natural hormone. So the menopausal symptoms stop. I've done that multiple times. But what I found out recently, there's omega-3 3,000 milligram dose. So I just listen, take the 3,000 milligram dose, right? And then for me, look, because you're going through that period, and what the omega does again is this: it takes the bad cholesterol in your body mix it up, especially the triglyceride, mix it up to give you HDL, which is decreasing at that time for women as well. So it binds it up. It's also good for the joints. As you know, now they're speaking omega everywhere. I've been talking omega, using omega for over 15 years. So the 3,000, I said, look, take it 2 a day for at least 5 days just to raise up the amount in your body, and you can take it every day. But on top of that, exercise, eat healthy, and then, surround yourself with pleasurable things and pleasurable people. And they often do well, and they come back and thank me. But I often joke, I say, listen, look, if you take this omega, it's going to take 10 to 15 years off your age. So yes, they have. And I said, listen, if your period has stopped, don't be surprised if your period comes again. Because you're taking you for, yes, I have to tell them. So, but if it does, guess what? You go get an ultrasound just to make sure there's nothing wrong in the ovaries or the uterus. And they're fine. They're like, Doc, oh my God, I saw it again. What the heck? But I said, you're 10, 15 years younger. What do you expect? I will laugh over it and they're fine.
Gee, I don't know about that period part.
I know, right? But I have to say, it's a disclosure. But not all of them do it, but I just say just in case.
Thank you so much. Thank you, Sister Janet Oludoyi, for asking that question. Very important one. Thank you. Now, Sister Ngozi Okafo says, as someone who is Gen Z, that she's happy a conversation like this is being had. And most of the perspectives of what we experience has been adequately addressed. That is Gen Z. I'm going to read like, I'm her now. Especially people our parents' age and coming from a public health background. However, acculturation is not the only issue. It's only the pressure some parents put on their kids over their kids' well-being and unique experiences related to social determinants of health plus racism that weren't parallel to people our parents' ages in Nigeria or Cameroon for some of us. One struggle is not more or less than another's per se, because everyone has a different tolerance. It's how an individual can handle, internalize, and process their own experiences and traumas that shape their resilience. What may not be a big deal for the older generation can be a very big deal for millennials, Gen Zs, and Gen As. Well said. I wish you spoke yourself. I wish you would raise your hand and speak. But thank you. Thank you for sharing, Dr. Aluyah. True talk.
Right.
And she said the college account is 523 plan. I kept saying this college account is 523 plan, that money can be put into for children and for grandchildren. And I think this is Dr. Ajay said, what Dr. Aluyah is saying reflects a good and godly legacy, something the Bible supports. As Proverbs 13:22 says, a good man leaves an inheritance to his children's children. This shows that thinking beyond yourself and preparing for the next generations is a mark of wisdom and righteousness. Thank you. So back to Sister Ngozi Okafor. He said, invest at home, sure, but also where your family currently is. Because the issue of family taking wealth after someone passes is not just Nollywood. People's children are suffering because of investments in places they won't go back to. A Barbadian colleague went through this. The father built a house in their home nation, but they were living in a tight apartment here. They spend more time here in terms of where they'll settle. Let's reprioritize. Thank you. Chica Emmanuel from Brazil says, thank you, Dr. Aluyah, for the brilliance in answering his questions. And it says special greetings from Naidoa, Brazil. Okay. Thank you to the organizers for this valuable time. He said he had to leave. Good night. And AI beginners courses are available on courseive.com for very little pay. Thank you so much, sir. Oh, women like Esther. That is Sister Matilda. Thank you. She said the AI for beginners course is on courseive.com. So, Dr. Aluyah, thank you so much. This has been fabulous. Can you give us your closing statement to wrap this up? Thank you, because we've learned a lot.
Yeah, my pleasure. Thank you for the opportunity to speak. It's always a pleasure. And when you call, we want to share because, again, we're a community. In the times of scarcity, people go tribal. And we'll see what's happening across the nation today. People are going tribal. White people are going white people. They're bringing some from South Africa. They're going white. Japanese are going Japanese. Spanish are going Spanish. So we as Black and Africans, we must also begin to learn to collate together, pull our resources together to achieve great aims in terms of wealth, in terms of intellect, in terms of support and encouragement for one another. Supporting, structuring, holding up, those who are champions amongst us, so that we will build generations of those who will do better than we have. But in doing that, you must of course take care of your health. COVID showed us that the world, when it gets sick, everything stopped. And we see that. If you were sick today, you will not be here. You will not be. If your family member was sick in the hospital, you will not be here. So prioritizing your health is important. Like I always say, take care of your body is the only place you have left to live, period. So as we said earlier on before I leave, everyone under hearing my voice, as Pastor will say, get yourself a primary care doctor, set an appointment once every year for an annual well visit. And when you go, document the things you want. Be what do you call it? Sunset, meaning, but at the same time, put your facts together and be ready to ask questions when you can. If you're in doubt, seek help. The best thing for anybody who would seek to be successful is the ability to seek help. And may God bless and sustain us all in Jesus' name.
Amen. Amen. Someone said, thank you, Dr. Aluyah. May God continue to bless you. I concur. I agree. Thank you. And thank you, Samsung. Thank you. Whew. Till we meet again next week, everyone, please stay safe. Let's remember all these important lessons and advices, admonitions that we got tonight. Critical, important, down to earth talk. Please remember and let's make changes. Thank you so much. God bless you all.